So good afternoon, everyone. I apologize. We're going to start just a minute late because the meeting before us, we're all learning how to meet in public. So the meeting before us went a bit long, and we're just going to wait for Supervisor Arenas because we told her this other meeting was going long and may have given her the wrong time. Oh, perfect. Given her the wrong time. But so give us just a minute. Thank you. Waiting for your binders? Okay, we'll do public comment. Okay, mine was down here, and I was up there trying to prep. So I get it. Okay. Well, so good afternoon, everyone, and I want to welcome you to the Children's Seniors Family Committee meeting. And we're going to begin with a roll call. But before we do that, let's do that. We'll do a roll call, and then we're going to have everybody on the dais just do a quick introduction of yourself. We'll go to public comment, and then we'll go to the agenda.
Good afternoon. Vice Chairperson Arenas.
Here.
And Chairperson Chavez.
Here.
Thank you.
Mystery solved there. Okay. So perhaps we can start, Sarah, with you.
Good afternoon, Supervisor Sarah Duffy, Chief Children's Officer, Office of Children and Families Policy.
Great.
Good afternoon.
Yeah, Nick, you have to turn that on. Yeah. This is the test.
It says it's on.
Yeah.
And we pivot. Nick Burchard, Chief Probation Officer.
Great, welcome.
Thanks.
Good afternoon, Ignacio Guerrero, Director for the Department of Child Support Services.
Welcome.
Good afternoon, Sandhya Hermon, Interim Chief Deputy SSA, sitting in for Deborah Portia-Usher, Interim Director of SSA.
Thank you.
Good afternoon, Michaela Lewis, Assistant County Counsel.
And Michaela, have you been assigned to this committee now?
I have.
Yay, welcome.
Thank you.
Good afternoon, John Mills, Employee Services Agency Director.
Thank you.
And good afternoon, I'm Greta Hansen. I'm the county's Chief Operating Officer.
Excellent, excellent. We're now going to go to public comment, and this is an opportunity to speak to the items within our purview, but that are not on the agenda. So if you are one of those folks, come forward, and each speaker gets 3 minutes until we get to 5, and then it goes to 2 minutes. So I'm going to invite up Dana, Nancy, and then Kathleen. Welcome.
Hello, I'm Dana Bennett, Kids in Common. It's nice to see you all back in person. And I just want to make a little commercial in that. First of all, I just want to say it's amazing we have such a supportive Board of Supervisors for children's issues. And I'm so happy to have you. So happy you're back, Supervisor Chavez. Just want to say the Children's Summit's happening on March 17th, and hope you'll be there. And we're putting the data online also, and they'll be released that day. And so the data book will be out, and everything's going to be happening. And it's just kind of an exciting time for kids in the county. So thank you, welcome, and see you around.
Good afternoon, Supervisors. My name is Nancy Bermeau, and I serve on the Commission on the Status of Women, but I'm here today to make this comment on my behalf and not that of the Commission. And while we're all happy to finally be back in person, I would also like to call attention to the need to continue a hybrid-style meeting. Allowing only written or in-person public comments limits the ability for many of us who would like to make live comments but cannot be here in person in the middle of a workday. Requiring in-person appearances for public comments and for those who wish to serve on commissions who are immunocompromised, have full-time jobs, childcare responsibilities, makes it almost impossible for many to participate in public service. Many of us who are most affected are women. Women who work full-time, women who are mothers, women who are caregivers to family members, or those who are immunocompromised. The switch to virtual meetings actually had many benefits associated to it, including allowing more members of the public to participate via public comments or watch the proceedings in real time. Public comments and presentations can be made over Zoom, Microsoft Teams, and other online platforms, allowing virtual meetings and also eliminating many of the scheduling problems here as the county struggles to find enough physical meeting space for 70-plus commissions and boards. I would like to strongly advocate that this committee and the Board of Supervisors considers a move to allow both virtual and hybrid meetings. Thank you all.
Kathleen? And Nancy, the board has made a decision to go to hybrid, and that'll be part of the February budget process. Yeah, we need some more staff and help. All right, welcome, Kathleen.
Hi, I shouldn't be nervous at my age, but anyway, I will let you know right up front I'm nervous. I'm Kathleen King, Healthier Kids Foundation, and I just have a cry for help for children. These are all underserved children, not foster, so it's not an item on the agenda. But Healthier Kids serves has about 84,000 services a year, 14,000 that get referrals for cases. This year, the services will be about 90,000 and 16,000 cases. 90% of our work is in Santa Clara County. Medicaid is 132,440 children in this county, FYI. And of the children we help in Santa Clara County, 76% are in high-risk zip codes, according to the county, and 75% live in qualified census tracts. The majority of clients, 85%, are children of color. And so there goes my data statistics. I'm going to just share a testimonial, the one that hurts the most. I was very concerned about my child's dental issues before HKF screened him at school. Noel often enjoys eating and drinking sweets. Plus, at times, my son would forget to brush his teeth and floss at night, and I have a lot on my plate. I didn't know how to get my child what he needed to get done. When I received the results from the school, I was still shocked. I knew Noel had dental issues, but I didn't know it was getting worse. He's only 5 years old and does have a hard time communicating to me if he has pain on his teeth. I also have been trying to get a dentist appointment for my child during the whole year of 2022, but the clinics that I have contacted wouldn't accept my child due to the number of extractions, the dental work he needed, and his insurance. I was frustrated, and it made me upset because it seemed like no one wanted to help my child. When HKF called, Sandy helped my child, and I find a dental clinic that was willing to take Noel in and accept the dental work needed. Sandy was patient and kept me updated with all the dental clinics she called. I work every day, and it is hard for me to find time to sit down to call which clinics would accept my son. Sandy went above and beyond by putting an emergency on Noel's dental case and bringing it to her management. Her management made it possible for my child to be seen right away at a dental clinic near my home. I think this free program is important to children in Santa Clara County because it helps children get seen in terms of their health. One main thing I can tell the person that is funding HKF is that this organization provided the support the parents are looking for when they need it the most and direct them to the right places. The services that Sandy provided to me was extremely helpful, and I am beyond happy that she helped Noel and I. I have another one, but I won't have time, and that mother works, she says, 11 hours a day. So parents just absolutely need to know how to use what they have. Thank you.
Thank you very much. I'm going to, Greta, did you want to respond further to the issue about the hybrid meetings?
Yeah, I just wanted to assure the public that the clerk's office has alerted administration, and I'm pleased to let folks know that we will be facilitating hybrid public comment starting next month for the Board of Supervisors meetings, as we have been doing, but also the committee meetings. So hybrid public comment will be available. The issues are more complicated for our boards and commissions, as currently state law has a lot of limitations on the ability of those bodies to meet through where the members of the body don't have to be in person. And so I just wanted to differentiate the issue of public comment from actually what the law allows, and Michaela can speak to that more, but I just want to make sure that for those who are tracking the issue, they understand those issues are a little bit separate. And just as you said, we absolutely have a good solution in place through the clerk's office for hybrid public comment for all of the board committee meetings going forward, presumably with the next CSFC.
And yeah, and I just want to say, I think the point raised about the disabled community is important, and so our board is also leaning in on advocating for that at a state level, because I think we've taught a lot of people how to engage. We don't want them to disengage. So thank you for that, for bringing that up. So next, we're going to go to our consent calendar and changes to the agenda. And I wanted to see if my colleague had any changes to the agenda or any items you wanted to recommend for consent. None? Okay. And let me also just say my standard, when we put items on consent, it isn't that they aren't important. It's actually often that the reports are written really effectively and we've been able to talk to you offline. I do want to recommend 2 items for consent. And let me just see, item 6, this is an item to receive a report from the Office of the Public Administrator, Guardian, and Conservator on the annual 2022 report. And then item 10 is to receive a report back from the Department of Employment and Benefit Services relating to ongoing supportive efforts to address workforce development gaps in CalWORKs participants. And again, the reports were very thorough. Both of these items are important because there's other work that's going to be branched off of them, and I'll be speaking to the department chairs to talk to, the department head to strategize a little bit about next steps for them. So we would put item 6 and item 10 on consent. May I get a motion?
Motion to approve.
Okay, we have a motion to approve. Are there any comments from the public on the consent item? Calendar?
We've received no speaker cards on this item, Madam Chair.
Great, thank you so much. And any of my colleagues up here have a concern about what we've just done? No. All right, so with that, we'll take a vote.
Actually, Madam Chair, I do have a question about item 6.
Then we'll keep it off the consent calendar. We'll only leave item 10 on consent. And we'll just take a vote on that.
Oh, got it. Thank you. Thank you for helping me out with that.
No problem.
All right.
Vice Chairperson Arenas
Yes.
and Chairperson Chavez.
Yes.
Thank you.
Thank you. So we're going to go to item 4, and this is a report from the county counsel's office and the CEO's office on CDAW. And colleagues, I just want to share that that the reason I put this on is that I didn't want to have much of a gap in time on this matter and would very much like to move it to the full board as soon as possible. So I did ask the staff, even though there wasn't a lot of time, to prepare a verbal report on this. And I'm going to, Kavita, am I turning this over to you? Great.
Not yet.
No. Okay.
Yeah,
There we go.
All right.
Yep.
whenever you're ready.
Okay.
Just trying to get our slides pulled up.
Got it.
Is that the
Nope.
one? Let's try. That's the only laptop I have plugged in.
And of course, I'm normally assigned to the Public Safety and Justice Committee, so the one time I try to moonlight and attend a different committee, I cause an issue with the slides.
Kavita.
Okay, so this will be a pretty brief presentation. It's really more of a status update and an opportunity to discuss publicly at our first in-person committee meeting where this proposal currently stands. So just by way of brief background, I think many will be familiar with this, but for those who aren't, the Convention on the Elimination of All Forms of Discrimination Against Women, which is abbreviated to CDAW, it's an international treaty that was adopted by the UN almost 45 years ago, but it's never been adopted on a nationwide basis by the United States. The principles of CDAW include many things that this board and the entire county organization has thrown its support behind for a very long time, and that really feel pretty foundational to our notion of equity here in Santa Clara County, including that women's rights are human rights, that there are a number of historical and cultural traditions that can stand in the way of women's full participation on an equal basis in public and private life, reproductive rights, an acknowledgement that a change in the roles of men and women are needed to achieve full equality for all genders. And as the slide says, since 2015, a group in the United States called Cities for CDAW has been seeking to have local governments adopt these principles and institutionalize gender-based equity analysis into their local operations. So the current status of where things stand with this effort is that the Commission on the Status of Women about a year ago recommended that the county adopt an ordinance that would implement CDAW principles locally, again, as I said, institutionalize gender-based equity analysis into county operations and include development of action plans to address gender disparities in the county and any barriers to full equality. The County Council personally met with an ad hoc committee of the Commission on the Status of Women back in November, as well as representatives from the Santa Clara University International Human Rights Clinic. And then on November 30th, a larger group of us, including 3 from the County Council's office, Dr. Luna, who's here with me, and others from administration, met and had really a quite robust conversation about the policy goals behind implementing CDAW and what work would be required to sort of adopt it into county operations. We had further written discussions in December, and currently where we are is in the process of working with a lengthy document that was provided by the Commission on the Status of Women and the clinic, integrating principles from CDAW ordinances that have been passed in other jurisdictions. So we're trying to sort of pull all of those together into what will be quite a robust policy document to bring to the board in March, as you said, Supervisor Chavez. And the plan is to meet with that same stakeholder group again over the next month or so prior to coming back to the board in March. So I'll pause there to see if Dr. Luna has anything to add, but otherwise we'll be ready to answer questions.
Nothing to add, but I'm happy to answer any questions about our plans for implementation.
Great. What I would like to do is go to public comment, and for the rest of the meeting, everybody will get 2 minutes for each public comment, and then we'll come back to the committee for feedback. So on this item, I have Nancy and Raymond. If you could come forward.
Thank you so much. My name is Nancy Bermeau, and I am here today on behalf of the CSW CDAW Ad Hoc Committee related to this agenda item. We look forward to our next meetings with County Council and Administration to discuss the adoption and implementation of a permanent CDAW ordinance, the supporting board policy, and the needed updates to the CSW ordinance to be brought back to the Board of Supervisors in March of this year. We would like to thank both supervisors for your continued support of the Commission, and in addition, we would like to thank the faculty and law students of the International Human Rights Clinic at Santa Clara University Law School, who have partnered with us in this effort and provided their expertise in creating a best-of-breed CDAW ordinance, which we have submitted. I'd also like to mention that 2023 marks the 50th anniversary of the Commission on the Status of Women here in Santa Clara County, which is the oldest commission of its kind in the state of California. And this year also marks the 24th anniversary since the county passed its first resolution supporting the national ratification of CDAW. While 24 years is a very long time to wait for a full and permanent local ordinance, the important significance of it has not diminished. By codifying CDAW into law, we will improve the lives of all residents and lead the way for many other jurisdictions across the state and the country to follow, which will eventually lead to the ratification of CDAW at the national level and assist in the passage of the 27th Amendment of the Constitution, the Equal Rights Amendment. Finally, we note the need for the implementation to be included in the ordinance itself with the corresponding details in board policy. Thank you both for your time.
Good afternoon, supervisors. My name is Raymond Rasser, and I am speaking on behalf of the International Human Rights Clinic at Santa Clara University School of Law in support of Santa Clara County's leadership to implement CDAW locally. As this committee knows, our clinic has been supporting the county in its initiatives to implement human rights locally over the past several years, and most recently to move towards adoption of a county ordinance. We appreciate this committee's leadership to develop effective measures to implement CEDAW here in Santa Clara County to protect the rights of our women and girls. Towards that end, we have welcomed the opportunity to consult with County Council and the ad hoc committee from the Commission on the Status of Women that is also supporting this important effort. Late last year, we met with County Council and members of the CSW ad hoc committee to discuss CEDAW implementation, and we were encouraged by the shared effort to find common ground in ensuring that the county adopts the strongest possible measures. As part of that collaborative work, we have produced and shared with County Council a draft CEDAW ordinance, which we hereby provide to this honorable committee as attachments to our written comments. And we are very much looking forward to continuing to engage in those conversations and communicate further with looking forward to continue. And we are really looking forward to continuing to engage in those conversations and communicate further with County Council as they develop their proposal that will be brought before this committee in the near future. As we've mentioned in our previous comments, we continue to support the adoption of a strong measure that will effectively implement CEDAW locally, ideally through an ordinance or some combination of an ordinance and board policy. We, the International Human Rights Clinic at Santa Clara Law, continue to hold ourselves as a resource to the county in moving toward accomplishing that goal. Lastly, Commissioners, kindly accept my gratitude for this opportunity to submit comments today and for our continuing leadership for your continuing and our continuing leadership to protect the rights of Santa Clara County's women. Thank you.
Thank you. We have no further comments, so I'm going to close the public hearing on this item, and I will see if Supervisor Arenas, if you have any comments on this item? Okay. So I have two. First of all, I'm very interested in knowing if we haven't had any meetings with the advocates, or you have not in the new year, is that correct?
That's right, Supervisor.
Okay. So what I wanted to make sure, Kavita, is that we make sure that we're meeting with the advocates early, and that's prior to a draft, unless you're far enough along on a draft that they can give feedback to it before it comes to the board. And my request is that if there's a difference of opinion on the subject, that's just clearly outlined in the staff report so the board understands the concerns of the advocates relative to the concerns of the staff. I think one challenge for the board on this item has been that it has felt a little bit like table tennis at times, and I really just want the game to end. And am really interested in having it come in March. And what I'd like to make sure of is that the board has enough information to actually take action on that day, if at all possible.
Understood. Thank you.
Yeah, and I do want to just say to staff, I really appreciate that that one of the challenges is both demonstrating serious leadership and also recognizing the way the county functions and wanting to balance that. And I think the advocates understand that as well, because, frankly, we have a board and a staff that's been really interested in this issue for a long time, so we'd like to get it moving. I'd really like to get it moving as well. Is there anything that you all need to get this accomplished by the March board meeting?
Not from the council standpoint, but I'll look at Dr. Luna for the administration standpoint.
I think we have a framework and an approach that we'd like to present in March. I think we'll be ready by then.
Oh, excellent. Women's History Month, too. So we're not missing that. So we're not missing the deadline. I'm saying that to you and everybody. Don't make me decide. Okay, good. All right, excellent. Any comments from my colleagues on this issue? No? All right, seeing none, there's no action to be taken here except to say thank you all very much for working so hard, and look forward to that final resolution. So item 5 is a verbal update on childcare for county employees. And I don't think we have any comments from the public, so I'm going to close the public hearing on that item. And I'm going to ask, John, I know, is going to give us a report, and I want to just thank the staff because we asked them to come back, Supervisor Arenas, because there was some confusion. It's a new program, and frankly, we're just kind of ironing it out. And I wanted to give John an opportunity to give us an update on that and then see if there are any questions. Thank you.
Yes, thank you very much, Chairperson Chavez. John Mills, Employee Services Agency Director, and actually with me at the staff table is Rhonda Schmidt, Employee Benefits Director. As you mentioned, we had a discussion with the committee back at the December 21st meeting, debriefing on the implementation of the new Employee Child Care Assistance Pilot Program, specifically the second iteration of the program, which was coincident with the flexible spending accounts open enrollment period in November. And we structured it that way so that we could have this program coincide with the Dependent Care Assistance Program and realize the tax-free nature of the benefit that the county was providing to its employees. And at the December committee meeting, the committee had a number of questions in terms of sort of lessons learned about the implementation and plans going forward for the next iteration of the program in the 2023 FSA enrollment period next November. And so even though the agenda mentions a verbal report, we did actually provide a written report that listed the questions that the committee had from December and then our responses to those, some of which also include contributions from our third-party administrator, P&A Administrative Services, who Employee Benefits Department staff were able to meet with yesterday to debrief also on the program and incorporate their input. So with that, I think I'll stop there, and we're available to answer any questions that the committee might have.
Great. Rhonda, did you have anything you wanted to add? Okay. All right. Supervisor, any questions on this item? Okay. So on this item, let me say thank you for the written update. I know we didn't give you a lot of time. I really appreciate it. I will say there are a lot of parents who are very anxious about the program, which is why we're pressing on. And I really, the outline here is something that is going to be really helpful, even as perhaps as part of the next phase of the FAQs, which will be really important. One question I wanted to ask is, do we have a clear assessment of the tax implications of the path we're choosing for employees who perhaps make over a certain amount or under a certain amount? Do we know the answers to questions? Can we respond to people who work for us and clearly help them understand how they would look at the tax issues themselves?
Well, so I'll respond, and Rhonda, feel free to supplement my response or jump in at any time. But so as you know, this Employee Child Care Assistance Program is a county-funded benefit. And the way the eligibility criteria work is the amount of the benefit is based upon the employee's salary. Because for this second iteration of the program, the first iteration was back in May, but the second iteration of the program, because we were able to have it coincide with the FSA open enrollment period and incorporate that benefit into the Dependent Care Assistance Program, we were able to, that facilitated allowing that county-funded benefit to be provided to employees tax-free. As you may recall, when we provided the county-funded benefit in May, since it wasn't part of the FSA program, employees were responsible for the tax liability on that county-funded benefit. There is a tax issue that we point out in the report that has to do with certain these cafeteria plans like this that are offered through the FSA program that are optional for employees to opt into. The IRS requires that employees do what is called non-discrimination testing, which is essentially to assess whether that benefit is being enjoyed by diversity of employees and is not, that you don't have a sort of a disproportionate representation of high wage earners. And so from that standpoint, some of the issues that had come up in the fall related to the question of gross income versus adjusted gross income, sort of the adjusted gross income route would capture more of what the IRS considers high wage earners, because I think their definition is 130,000 or more annually. And so using the gross income criteria that the board approved for the eligibility criteria for the November iteration of the program helped us address that non-discrimination testing issue from the IRS perspective.
That's very, very helpful. Thank you.
Is there anything else you want to add, Rhonda?
Sure. The only other thing that participants would need to consider in participating in this program is that there's also a child care tax credit that employees could utilize as part of the tax return process, but they cannot participate in both a dependent care assistance plan and the child care tax credit. So they would need to work with their tax professional to determine which program is a better benefit for them.
Just one last question, because I think I know the answer to this, but thank you for that piece of information. When we're doing the recruitment and the signups for this kind of product, especially because it's so new, do we do like online workshops just to help people know what questions they need to ask, under what circumstances they should talk to the folks who help them with their taxes and the like?
We did not do workshops this last time around, but it is a great suggestion that we can implement for the future. We did include in the application a series of check boxes of issues like that one to ensure employees understood they had to check each box, and we made sure issues like that were included in those on the application.
That's very helpful. I would recommend that we do something like that. I think first, I think it would be easier for our employees to get information, because you can listen and do other things. If you need to, you can also call up the application during the process, but also so people understand eligibility. The other thing I think that benefits us is when people are able to ask us questions, it really helps us understand whether or not the communication we're sending out is clear and understandable. And I think you all do a really good job of making, trying to take jargon out of it, but, I'm presuming that a lot of the folks who would be using these services are newer employees too, because they're going to be younger if they're having children and may not be as familiar with even being a public employee. And so I think that would be great. And if you could let us know how that goes. And frankly, I'd be interested in how many people even participate. So if we sent it out to everyone, how many people decide that that's a valuable way to learn about the program. And then lastly, second to this just made me think about it, with SCC Learns, do you also put in videos there for, for services that your department provides?
We don't typically, because SCC Learn is more of a training module. So we don't do sort of education there on the employee benefit offerings. We do that more through the onboarding process and the orientations that we have with employees when they start.
Okay. I mention it only because a lot of us, we have so many trainings we need to get a year and it shows you a menu of what you could get. It might just be something to think about. Again, it would have to be refreshed, but if it allows you to replay any training that you do, it may be just a low bar for someone to get more information about an opportunity the county has to offer. And I think it's particularly important as we're competing with the whole world for employees right now, literally the world, depending on the department. Okay, great. Thank you very much. I don't have any other questions, and we'll move on to our next item. Appreciate that work. We're going to move on to item 7. And this item is the opioid settlement and bankruptcy expenditure plan. And I'm not Sure.
Madam Chair, my apologies. I had that we had, you did not put item 6 on consent after all?
Oh, I apologize, I skipped it on accident. Thank you. We'll go to that item, item 6, and that's the public guardians item. Thank you for catching that. I'm sure Sylvia would have thrown a pencil at me in a minute, but good, saved me. Welcome. Did you want them to do a presentation, or would you like just to ask questions? So Supervisor Arenas is prepared just to ask her questions, if that's okay?
Absolutely.
All right.
Good afternoon. I'm Marianne Warren, the Director of the Department of Aging and Adult Services and the Public Guardian Administrator. And Lisa Pache, to my left, is the Chief Deputy Public Guardian Public Administrator. And welcome.
Do you want to introduce your other colleague?
Sorry, Susan Chang is our Senior Management Analyst for the Department of Aging and Adult Services.
Great, welcome all. All right, Supervisor.
Thank you. So my question really is about the increase that was reflected in the report for the LPS Act conservatorships, referred to as Murphy conservatorships, right? And I'm just wondering why, if it has to do with maybe the implementation of care court, or what other factors could there be? Because this seems to be quite a bit of an increase.
Care court hasn't actually been implemented yet in our county, so so that's not it. But we did have a huge increase in Murphy referrals for LPS conservatorships, which are people who have felony charges pending are unable to assist in their own defense and incompetent to stand trial. Those went up about 60% this year. And then the standard referrals increased as well. And just in the last 3 months, however, there has been a decline since the 5270 30-day hold was implemented in October.
Did you say the last 30 days there's been a decline?
The last 3 months.
3 months, I'm sorry.
It was implemented October 1st, and we have had 91 5270 holds since then. So those people were not referred for conservatorship with, I think there were 6 who went from a 5270 hold to a permanent conservatorship.
So then what do you, aside from having this increase in referrals, is there another kink in the system? Is there something that we should expect to, do we expect to see this, or do you, I mean, I'm just trying to figure out if you all have drawn a line towards that increase.
I'm not understanding this question, sorry. So are we expecting an additional increase?
Right. Are you expecting to see this kind of increase for the rest of the year? Or do you think with the 5270s that there's an alternative, and so there's not going to be an increase like you saw in the last three months?
There's an additional new hold that County Council is more familiar with than I am that will be implemented, and Care Court and the 5270, so I don't anticipate the same increase. However, it fluctuates, and we just don't know. We get referrals from all the hospitals that have inpatient psychiatric, and we process all referrals that come our way, so it depends on what the hospital is referring to us.
And what is the main, have you noticed if there's one particular hospital that has been referring in more than the others, and that they hadn't maybe before? Maybe they got a very specific, I don't know, case manager or something.
Well, the largest referring is BAP, Barbara Aaron's Pavilion, which is county-run, but they have consistently been the highest referral for years.
Okay, so from your observations, there isn't something that you've noticed in the existing referral sources. This just happens to be a jump.
No, just this year with the Murphy conservatorships, and I can feel Lisa wanting to chime in.
So I just want to be clear, because LPS is severely mentally ill folks. That's who we're talking about.
Right.
The Murphys that are in our report that we report out on, those are people who are incompetent to stand trial. So that is a small portion of our 700 clients. And so what we reported out, though, which was interesting, is that those, the people who have a felony but incompetent, those have increased by 60%.
Right.
We really don't know why that is. There is some legislation that's changed, and we are working with county council to see if maybe because of some of that legislation saying that folks who are on a Murphy hold need to move to a lower level of care after so many years, and then what happens is they reoffend or don't reoffend, most often reoffend. But they also have to have the mental illness along with, of course, the felony.
Right.
So interestingly, we see it across the board in all the counties, but it seems that Santa Clara counties have increased a little bit more than some of our other counties.
And is it outside hospitals outside of Santa Clara County that are referring from the psychiatric, like the emergency psychiatric services?
Not for the Murphys.
Not for the Murphys.
Because the Murphys are, have to do with criminal court and a referral.
Got it. Okay. Thank you for drawing that distinction.
Supervisor, you may have another response to your question.
Yeah, I was just going to add, just as was referenced, there has been a change in state law that's driven up the number of Murphy conservatees returning from custodial facilities to the community statewide. That's created incredible pressure not only here, but across the state. And actually a deep dive presentation from County Council and Behavioral Health specifically on that issue is one of the items that we're planning for the February Behavioral Health Monthly update, because there are some real legal complexities that are impacting the number of Murphy conservatees that are not only affecting the public guardian, but also affecting behavioral health and driving what's really a pretty significant crisis statewide in needing more non-carceral placements for Murphy conservatees who we'll hear more from the folks in the County Council's office who are working both with this team and also with behavioral health, but where folks would traditionally spend more time in custody before being released for placement are now exiting custodial settings more quickly based on a change in state law that has created a sudden bolus of folks who really need placements that are hard to come by. So that will be something that the board will hear a lot more detailed information about, including from the legal and the county council team working on it in February.
Perfect. And then I will ask more questions then. So thank you so much.
Thank you. Thanks.
Yeah, and just if I could make a request, and that is that if this report could be included in when that issue comes to the full board as a standalone document. I thought this was really helpful and very well done. And I would also just request that the actual state law be included as well, because interestingly, I will tell you that I spoke to one of our partners that does work with the courts that was asking the same question and seemed unaware of the new change in law. So I think just having the law as well. And then I just have a follow-up question. On packet page 14, as part of the intake referrals received, first, I really appreciate that you're starting to track in more detail where we're getting folks, how many of them are homeless, and I think that's going to be very, very important as we think about workload and strategy. But what I was also interested in was understanding the alternative plans that are referenced. So it says 206 temporary conservatorships were terminated when an alternative plan was found. And if you could just give us a flavor of what an alternative plan is.
Did I turn it on? Or? Yes, I did. Okay. So alternative plans they're no longer gravely disabled, and therefore they might go home with a family member. They may go to a lower level of care and not need a locked facility. They go to a boarding care. They may move out of county. They may pass away. So alternative plans can be a litany of things, but the doctors can also say with more treatment, like the 5270, they are no longer gravely disabled.
So one thing I would just request is that I think the disposition of the terminated temporary conservatorships are really important for us to understand, because I think one of the things that you referenced earlier, or items you referenced earlier, was folks that become repeat offenders. And I think what we're really trying to understand is, when do we see people cycling back through a system that frankly, had we had a stronger, more robust set of alternatives for that person, we wouldn't see them. And so I think that would be very interesting to understand. And perhaps when we have this discussion at the full board relative to the bigger issue, if you could come with a little more detail on that particular group of people would be very helpful. And again, thank you for the report. I thought it was very, very helpful and very well done.
Thank you.
So with that, I think do we need to receive that? Yes, a motion to receive.
Motion to approve.
So a motion to receive the report with 2 requests as this comes to the full board for discussion, and I will second that.
Right. Vice Chairperson Arenas
Yes.
and Chairperson Chavez.
Yes,
Thank
thank
you.
you. And now I'm going to item 7. Thank you both very much. Item 7, take 2. And I think, am I expecting Sherry or? Welcome. Rhonda? Rhonda's just going to sit in back there and tell you guys what to do. All right, welcome.
Good afternoon. I am Edwin Poon. I am the Deputy Director with the Behavioral Health Services Department, overseeing the managed care operations. And I'm also the Alcohol and Other Drug Administrator for the County of Santa Clara. So for today, we really appreciate the opportunity to review our proposed framework for using the settlement funds that the county is receiving to support the expanded services for those who are struggling with opioid addictions and other substance use disorders in our community, to support their recovery, and also reducing the future impacts of the widespread availability of these drugs that led to the national opioid epidemic. This report is going to provide, we're providing today is in response to a December 6th Board of Supervisors meeting request for us to report back on recommendations on the use of opioid settlement funds, which also include a process for obtaining community feedback on the use of the funding to effectively address the issues here in Santa Clara County. So I would like to start off with a review of the funding anticipated by the county as part of this settlement agreement, and I'm going to hand it off to Laura.
Laura, your mic's not on.
Oh,
there you go.
now? Okay. Apologies. I'm Laura Trice, Deputy County Counsel, and I'll just go over this first slide on settlement funds and requirements. We currently have 2 settlements that will be providing funds to the county for use in the treatment, prevention, and other efforts to address the opioid crisis. Those are the Janssen settlement and the distributors settlement. These will be paid out over a fairly lengthy time horizon. So the distributors settlement the county will receive 18 payments over approximately 18 years. From the Janssen settlement, the county will receive 11 payments over what will probably amount to 9 years. We estimate that the county could receive a maximum of about $48 million over the life of these 2 settlements. And the county has already started to receive funds from the settlements. In November and December, the county received the first 2 payments from the distributors settlement, and that amounted to almost $3.6 million. And we are expecting the first 2 payments from the Janssen settlement to arrive probably in late February. And we do have a slight update on that. We've received notice that those first 2 payments will total about $2.083 million, so slightly more than is reflected in the slide. After those payments come in, we should start getting payments from these settlements on a more regular once-a-year schedule, probably starting in the summer or fall of this year, and then annually from there on after. The board should be aware that the funds do have some time limits on them. They don't have to be used immediately, but they do generally have to be expended or encumbered within 5 years of receipt. The exception to that is that if the funds are designated to support a capital outlay project, they need to be expended or encumbered within 7 years. And if they're not expended or encumbered within those timelines, they will be transferred back to the state.
Thank you, Laura. So if we move to the next slide. Thank you. So the use of the fund also require establishing a process for community feedback. So I'm going to describe our approach with you right now. So to start, we are proposing what we called a phased approach that's going to establish a process for community input through partnerships with our public health department here. What we really focus on is the value and the importance of gaining the stakeholders' input, both for short-term as well as long-term planning, and also focus on the broader framework for other strategies to address the substance use disorder treatment, opioid addictions, to essentially focus on the most effective way that we can leverage these fundings. Several key partners that we will be engaging in this strategic planning include the Fentanyl Task Force, the Santa Clara County Opioid Overdose Prevention Program, also the Drug User Health Advisory Council, the behavioral health departments of all of our community partners, and inputs from individuals who are currently users as well as former users of opioids and now in recovery. So we will also be looking at expanding outreach and participation to other groups as part of our overall efforts to engage with the community. With the support of the board, a portion of the funds will be utilized to support these planning efforts, which will be jointly led by behavioral health and public health, with public health partners having a lead role in this. And then separate from the planning process, there are going to be certain key initiatives that we've been identified as high impact needs that already exist today, and that we're proposing to make immediate investment in addressing these areas. And if you can change to the next slide. So I'll walk through some of these 6 areas with you this afternoon. The first one is the idea of that we need data-driven decision-making. And this, to us, is a very critical steps to evaluate the effectiveness of our existing as well as future programming, particularly in the area of outcomes. So what we're proposing is to invest a portion of the funding to strengthen our data collection, to support the informed decision-making process, and also help us make appropriate recommendations of where the current needs are, how effective the interventions and prevention strategies, and also future modification to the programming that's offered to the community. And this effort will be led by our public health department's partner. The second area focuses on expanding services to youth in the school system, which is, we're going to include that as part of our initial recommendation because we wanted to focus on the use of this fund specifically to target youth through prevention efforts. We know that approximately 1 in 5 youth deaths last year were due to fentanyl overdoses, and this continued to trend upwards. Services within the school will be expanded, and those services are areas considered high risk will continue to be prioritized. We'll also include consultation services to teachers and administration. The third area that we're recommending is the continuation and expansion of the county's effort at naloxone kits and fentanyl test strip distribution throughout the county. to include training in the use of these critical harm reduction tools. We know that this is a priority by the governor, and that the county will leverage these funds with anticipated additional funding from the legislature to expand this current effort. The fourth area that we're going to focus on is going to be looking at a number of areas in the counties where we can expand medication-assisted treatment. We believe that there will be benefit from the expansion of MAT and on an outpatient basis in community and potentially embedded even in the primary care setting. So we're proposing a dedicated portion of the funds to support this effort. Next is expanding youth substance use disorder residential services. And for this area, we recognize that there are becoming a growing need and has developed much for residential substance use services for youth. And we recognize that there's a slower than what we expected in terms of the development compared to adult, even statewide. So a portion of the funding is proposed to use to expand a contracted bed for these services for youth. Last but not least is to support the cost of an addiction medicine physician. So what we're looking for is expanding the clinical expertise available to the Behavioral Health Services Department, and so that we have this new medical director to oversee the expansion of these services and helping us navigate and support us in providing us with expert consultation, overseeing the system improvements, and also supporting us with consultation and oversight. The SUDS medical director will work closely with our public health department's partner to implement the recommendations from the proposed strategies planning process. So that concludes our presentation, and at this time, we'd like to answer any questions that the supervisors you may have for us.
Great, thank you. Thank you for the thoughtful report. I do have a kind of overarching question, and I'm not sure if this goes to you, Greta, or to the team. I know we're working really hard to make sure that we're integrating our services, so I'm very excited about the partnership between behavioral health, public health, and within behavioral health, we have substance abuse and then the healthcare system, which is attached to that too. I'm wondering, the lead agency, like if I want to go back and say, how's the whole plan working, who am I asking?
I would say, so the county council, I'd say it's a partnership, but I would say that the lead agency in terms of service delivery utilizing the money would be behavioral health. We're really focused primarily, in part due to what the vision was for use of these funds, on trying to focus the funding on dealing with the consequences of the opioid crisis, which is most profoundly opioid addiction. And so, although there's certainly work that's going to be done by the county council's office in partnership with them, and also by public health, as you heard, if you had to say what was the agency that's actually in the lead on this work, just given the focus of the funding, it would be behavioral health.
And one recommendation that I would love you to think about is that I think for a lot of these items, particularly where we have broad teams, it would be really helpful to have the team captain in the actual ledge file. And one thing, colleagues, I'll share this with you, Sylvia, is that I've really been asking the staff to do their best to integrate into our staff reports, whether it's background or in the lead, just for example, when I first got here, I remember that Ken and David worked on this environmental issue for years, and I was like, why are you guys doing it this way? And I didn't really know it was community driven. I had no idea. So anyway, I asked them to be as rich as they can with the background, so you can say, and then you could actually reach out and talk to the person, so you could better understand what the goals were. But I just want you to give some thought to that. And even though it's dated because people move from point A to point B, at least as we're digging in, we'll have a much better sense of, okay, this is our lead entity. So anyway, just give you some time to think about that.
Yeah, maybe I would just ask, this is a little riff off of the specific comment you just made, but since you were talking about it in a broader context, I think one thought that I've often had in reviewing ledge files more generally is that because the background section is at the end, the context that people really need to understand what's often the reasons for recommendation comes when you've already sort of read through that, and then you sort of have this, oh, aha, now I understand it when you get to the end. So in part, one, I'd ask for your feedback on whether that's often your experience, but two, I do think that sometimes the background and context gets a little bit short shrift, even just because of how we've decided to structure the format of our ledge file. So if that resonates, we'll also kind of take that back a little bit.
I think you're exactly right. And one thing I'll share, and it might not be a bad idea for us just to share what we use to track progress in our offices, which I'm happy to share with you, because we actually keep a record of when, how something gets established, and then who leans in, so that we're following, not, both what's your ideas, what's a colleague's idea, what we get from the community, so that we better understand where we are in the process. So yeah, that would be really helpful. The other thing that I would just add here is I heard you say you'll engage the fentanyl working group, which I really appreciate, because I think there's a lot of people there with lived experience, either who've lost a child or who've had addiction issues themselves. So I think it's a great group. The other group I would really want to encourage you to reach out to is the Health Disparities Task Force that we have established at the county. And I'm sure I'm saying the name wrong. The health, it was part of Susan and Lee's, Otto's equity work relative to our medical investments and our public health investments. But I think that group, what's interesting about it is it's just a really great cross-section of the community, and they're really trying to reinforce how we're looking at equity and investment and strategies. So I think they would be a really good group to include. The other issue that I would just want to raise more broadly is this. I think that I have been surprised in the work that we've been doing with the fentanyl working group of how many parents tell us they'd never heard of fentanyl before their child died from it. The number of young people who know that there's some concern about counterfeit pills, but don't, they have heard a pill can kill, but they're not digesting information we're giving them. And the other thing is that I do think we need to, and this brings me to the last point on this thought, is that having our public safety partners with us is really important, because one of the issues relative to communication is that people are accessing these pills via TikTok, Instagram. They're getting them delivered to their homes. And I can't imagine a parent just takes that in and puts it on the kitchen table and waits for their child to come home and, wouldn't at least be concerned if they knew that they could be getting it literally delivered to their homes. So I want to just emphasize two things that I think need to happen right away and need to be prioritized. One is that we have to double down on our communication with parents and youth. And second, I think we need to be much more organic with our communication tools. When District Attorney Rosen and I went out and talked to the community about how they knew anything about fentanyl, almost all of them could pull up their phone and show us, like, I talked to one mother, not mother, she's a mom, but she was talking to me in the context of having a friend who had an addiction. And she told me that what prompted her to warn her kids was actually not the friend she had, but seeing a mother on TikTok pleading to not let their kids die. And I think the reason for that is it was authentic, it was real, it wasn't manufactured in a room with sticky notes, which is what we do. So I want us to really look at investing in authentic, developed communications that is already having an impact on people, if in fact it's legitimate, by legitimate, accurate and real. I think we spend a lot of resources, and we should, on communication strategies, but they're not done with, even if they're done with some sort of focus group, we actually know what works because more people like it. Like, we see it in real time, and I think I'd rather spend money boosting an effective message than trying to craft one that's as effective as something that we're seeing in the community already working. And I actually think it's really, if we're going to be really client-centered and we're really going to be dealing with what moves people, we have to accept what does move people versus what we want to move people. And both relates to the parents and to kids. And then the other thing is that I think we should be learning from what people are already liking and using, because, you know, from talking to some of the young people we talked to, they are, you know, if you're 20 and you're over 23, you're old and uninteresting. They're just not listening. I mean, you know, we go onto college campuses and we're like, hey, and they don't care. So I want to just make sure that, like, maybe that's something else we could learn about, the appropriate messenger based on the type of message we're trying to share. And I know, again, we do that with focus groups and all that, but we're seeing it in real time. Like, there's a way to learn from that. So those are things I'd really like to see when this comes to the board in terms of what we're funding. And then I do want to say I thought this was a really, really thoughtful framework, but let's make sure we include our Health Disparities Task Force. That's what their name is. Anyway, and the fentanyl working group, I really appreciate including that we're really looking at authentic information, that we get a team captain so I know who to follow up with. And then I really want to encourage us to invite our public safety partners, because that access question is the public health problem, or the behavioral health, you know what I mean? It's all the same problem. And I have found Edwin at the DA's office to be incredibly thoughtful about how they're trying to pursue this. So I'd like to bring them in. Any concerns about any of that? No? All right. Sylvia?
Thank you. I also thought this was a wonderful, crafted, thoughtful report. I was really interested in seeing, and I was really interested in seeing that there was a strategic rollout of what was going to happen in this process for implementation. And I have some questions around it, and you all probably have answered it among your multidisciplinary group. And it is really, how are you going to designate the funds between short-term plans in terms of responding to this crisis in the now, and then the medium and long-term plan? And how are we going to balance the administrative portion, the investment in administrative tasks versus the direct services?
First of all, I want to say that there are certain parameters that the funds dictates how we would utilize that. And so I think Laura may be able to speak better than I do, but I do think that there are some parameters, including that within a certain percentage of the fund has to be focused on what we call the high, I forgot the term.
The Department of Healthcare Services is calling these areas high impact abatement activities or areas.
So yeah, so there are parameters that we will have to follow based on the settlements agreements, and there are reporting requirements that we will have to abide to. I think with beyond that, this is where we believe really strong, coming out strong with the strategic planning and really engaging with the community becomes fairly important, because this is not necessarily something that just the department or internal county staff will be able to kind of make that decision alone, but rather that we wanted to leverage the strategy that we stated in terms of the phased approach, in terms of the engagement, to establish both short-term and long-term. And again, what we really want to do is also not just focus narrowly on the opioid settlement per se, but rather expanding that, how that really also incorporate our larger focus on substance use treatment, as well as also the integrations of physical, behavioral health, mental health services, and how all that comes together to really support those individuals, because we understand that many of those challenges are very complex. So that's where we're hoping for, and that's where we really think that coming really strong upfront, having that strategic planning, it's going to yield a strong, comprehensive plan.
Thank you. I think it's important always to hear from our community, right? They know what those issues are because they're dealing with those issues, especially for those of us who have, I have a 14-year-old son and an 8-year-old daughter who thinks she's 14, but she's not. But this 14-year-old, you know, he looks like he's 6'2", and he looks like an adult, and there might be folks in you know, his surrounding environment who may approach him differently, right? There's a high school not too far from his junior high, and so, you know, I worry about these things. Of course, having conversations with your children is one of the best ways, and before they become teenagers, because as Supervisor Chavez noted, we are no longer interesting. And it might not be the best source of influence for our teenagers, even if we are their parents, we gave them life, right? Please read that into the record once again. But let me go back to, it's interesting that you brought that up. Well, and I'm still going to go back, and maybe that we can have this conversation offline, because I'm still interested in seeing the investment between the now, the current, and responding to the crisis, and doing that through community input is important, but that takes time, right? You have 9 years for one, and I forget what the timeline for the other, over the time frame for the other.
18 years.
18 years. So literally somebody could have a baby now, and by the end, they'll benefit from the whole grant funds, or not the grant funds, but the settlement funds. And so I think it's important for us to be very cognizant of that. And then I love that you just referenced that we shouldn't just focus on fentanyl and opioid, because it's not just the only issue that's impacting. There's a lot of other drugs. I think there was an advocate who shared with me that there was, I think, 4 new date rape drugs that Stanford was dealing with. And I just, you know, it blew my mind. 4 more. I mean, I think we have enough that just create a lot of chaos for our communities, and it's unfortunate that folks keep being creative about this. But along those lines, I was thinking, how are we bringing in some of these other issues that are related to substance abuse? For example, in a later item, we have the sexually exploited, the commercially sexually exploited children, and the substance abuse parallel that a study, a white paper, found between that population and substance abuse. And so if we have funds now that we know are coming into the system, and we have gaps in the system, especially around very fragile, very, you know, the sexually exploited children, for me, is, I think, a very top priority. How do we draw that intersection? Because here we have both of these items, and I haven't seen that. And I don't know that we'll hear that from our community necessarily.
Yeah, so thank you for that comment. Really appreciate, because it really remind me of that. We definitely want to be inclusive, but we also wanted to really listen, because we know that there are many intersections when it comes to, you know, the addictions, and as you pointed out, opioid, obviously, is the focus of the settlement fund, but we really need to really expand our viewpoint. And so I think what we're going to be ready to do is to really embrace and listen to the various different ideas from the communities, really trying to understand and be able to have those target focus that we can make this successful. And again, maybe going back to Supervisor Chavez, your comment also about that, you know, the target populations, it's gonna, we kind of have to focus our communications very specific to different target populations, and we may think that 1 or 2 years of difference in a teenager may not be very significant
Oh, no, it's
from
huge.
our
It's
older
huge.
self perspective, but as
Right.
you pointed out, that the communication could be completely different, different strategy, different mode, different messages. So I think this is where I think the opportunity for us is both, as you laid out, that short term there are definitely strategies and investment that we can make, but those engagement, we expect that they're going to yield these longer term strategy, and we will be happy and excited to come back to the board and share with those ideas with you as well.
And I appreciate that. My question will still stand, and maybe we can take this offline, because I do think that there needs to be some level of consideration for the different populations that we're already serving. These are folks that are already in the system, right? These are kiddos that, and I don't know from the White study, and so this would be on you all to share with me as I learn. This is what my 3rd week on the job, so please be patient with me in trying to learn more. But I just wonder, how do we know there isn't a high impact of fentanyl and opioid overdoses in commercially sexually exploited children and youth? Because that, I think for the youth, it goes up to the age of 25. And there's drugs are certainly one way that just the bad guys control children and control youth. And I know while I was sitting on council, in the second year, no, it was, I think, the first year of the pandemic, there was a 300% increase of online child abuse cases and attempts from what our police department unit reported to us, meaning that the folks just change their strategies, right? And substance use has always been part of a strategy. And so I just like for us to lay over some of the work that we're already doing and see how we can leverage the resources we have at hand.
Supervisor Ennis, may I interject something?
Oh,
here?
yes.
My name is Zelia Fourier-Costa. I'm the Director of the Children's Services for Behavioral Health. And I just wanted to add a comment related to the specific population that you are bringing up. The sexually CSEC youth. So we do, for behavioral health, we do operate a county program. We call them the transformation team.
Right.
They work specifically with this population, and although they are not the experts in substance use treatment, we've invested quite a bit of funding and training in our clinicians. So we call them co-occurring capable clinicians, and they are on track to also receive additional training to be able to more seamlessly approach the needs of youth, both mental health and substance use. I think that later you probably will hear some of this through the item that's coming up later, but I just wanted to let you know that we do think about those things. And
of course,
I think the opioid funds will add much needed training and expertise once we have another director in-house. I wanted to share that with you.
Got it. And I know, Greta, you have a response, but I'm just going to take a look at what we're doing administratively and what are we doing direct service, and how are we pulling from within your own system here, that I now will call our system as I'm growing in my capacity here. How are we being efficient with leveraging our own internal resources? And that's really at the helm of my question here. But Greta, I'm so sorry,
no.
Chair. Look at me.
The most informal person go ahead, Greta.
No,
jump
no,
in.
I was only going to turn my light on to invite Zelia to just add some comments specifically in response to your question and to kind of situate the work that will be enhanced through these opioid funds in the ongoing work that we're doing to support CSEC youth and really be kind of at the forefront of trying to serve that population well. So Zelia, I don't know if you had anything else that you wanted to add, but really I was just inviting some of the comments that you already made.
Yeah, I think the only thing that I would want to add is that we really are trying to move away from what we call coordination of services and provide integrated services. So when we talk about mental health issues, substance use issues, physical health, that's really the goal of what we're trying to do with our system of care for all the populations that we serve. So
If I could
love
just
that.
follow, oh, go ahead. The only thing I was going to say is, Zelia, I really appreciate the distinction and recognize that, all of the integration that we're talking about is like works in progress. And I think one point I just want to really focus on that Sylvia just raised is that I do think that we sometimes miss opportunities in our own system. I think everybody here would just acknowledge that we, Group A is doing X and Group Y is doing Z. And as a matter of fact, part of the reason that we were so interested in bringing Sarah, the part of the vision around the Office of Children's Advocacy was really to make sure that that we had folks that at a top level are really looking across all of our systems and finding those missed opportunities. And Sarah started not too long ago, so you guys are kind of in the same class, so to speak. But I do think the point you're raising is really, really exceptionally important and valid, and one that, but frankly, even on the issue that we were, one of the earlier items that we were talking about, even as we think about children who become homeless, like we know they're using survival sex and to access drugs and all that. So I think the point you're raising is right on, and that's partly, no pressure on Sarah, but that's partly going to be part of her helping all of us, irrespective of where we are in the county, to respond. So thank you for that. So we have given you a lot of feedback, and let me just see. I think this was, I don't know if it was a received report or if it was really just informational. Yeah, so we'll receive the report and incorporate the thoughts that we had into your actions. I don't think any of them were challenging or not something you might not have already been thinking about. Is that accurate?
Yes.
Okay,
Yes.
so there's nothing you have questions about. All right. So with that, I'm going to ask for a motion.
Motion to receive report.
And a second, and ask the staff to make sure that the outreach is addressed, and that when this comes to the full board, that perhaps the question that Sylvia asked can be embedded in about what that interim set of activities are.
Understood.
All right, thank you. So we have a motion and a second.
Vice Chairperson Arenas
Yes.
and Chairperson Chavez.
Yes.
Thank you.
Thank you very much. We're going to move to item 8. And this is to receive a report from the Division of Equity and Social Justice, Office of the County Exec, relating to considerations for quantitative measures to demonstrate equity impact.
Good afternoon.
Welcome.
Rocio Luna, Deputy County Executive, and with me today is Maribel Martinez from the Division of Equity and Social Justice. I want to keep my comments pretty brief because you have the report in front of you, and the report really provides just a cursory overview of potential examples that we could leverage to identify equity indicators that would be relevant to our county. It does not provide you with an exhaustive list of a recommendation. So we don't have a recommendation for you today, but it's partly due to the very wide variability of possibilities that we can select from, and our recommendation that we have a thoughtful, engaged process to help us really identify, come back with a recommendation that would really identify a comprehensive list of domains, indicators, and measures for your consideration. At the moment, our division does not have staffing with this level of expertise to really look at the type and level of data that would really be the most relevant, although we are working to hire staff with this type of expertise. And Maribel probably has a little bit more to if you would like to add anything to that, and then we'll open it up for questions.
Sure. The only addition to Rocio's comments is that the level of complexity for us to really arrive at indicators that will show impact is going to require community engagement. It's going to require stakeholder engagement, and for us to arrive at definitions for terms that perhaps we're very familiar with, but definitions are varying, and for us to zero in on what we mean and have an operational definition in which complexity and expertise from demographers, from statisticians, would benefit this process, because once we set indicators, we want those indicators to be the measures that we use over time, so that when we set our dashboards, we can actually see, have we made movement in these areas to the level where we can statistically demonstrate our return on investment, knowing that there are other factors that come into play with large topics such as housing and education, and that there are multiple factors that come into play. So with that, we welcome comments and questions about this topic.
Thank you. I'm going to go to the public for a public comment, and then I'll come back to the board. So if I could start with Kathleen King.
Hi, Kathleen King again from Healthier Kids Foundation. We started looking at this issue just based on our referral rates. So we could tell in dental if a referral rate in one area was 20% and it was 40 in another area, we knew that there was probably a much higher need. But then we overlaid it on a risk assessment that the county did. Unfortunately, the one we have is from 2013, but it took all these parameters of safety, number of parks, how much crime, et cetera, and then it scored them and came up with a score for each zip code. And we were really pleased to see that 76% of our effort last year was in those zip codes. And then we looked at qualified census tracts with the one of the American Recovery Grants. And even looking at that, we were at 75% of our services were in those areas. So I just want to recommend a very simple way to maybe start is to look at the qualified census tracts and this high-risk county zip code chart as a place to start. And maybe the high-risk zip code chart could be updated. And from there, you can look at demographics and other issues. I just think it's a simple way to start.
Thank you, Kathleen. I'm going to close the public hearing. I have no other public comments, and I'm going to go back to the board. And this is one of those areas I'm going to be looking to all of you on the dais to also give feedback. And Supervisor Arenas, before I turn to you, I just want to make an observation, and I do want to get feedback on this. You know, the department, as it got set up, really began by the board and the community and perhaps members of the administration saying, we need an office of, and we started off with an Office of Women's Policy, and then an Office of LGBTQ Affairs, and an Office of Immigrant Relations, and now I hope an Office of Disability Affairs soon coming online. You know, like all of these offices, and I think the reason we did that, well, I know why, is that we saw a significant gap in services or making things customized enough to respond to our clients. One of the concerns I have is that we've heard about GARE, the tool, the budget tool, which, you know, frankly, even after that, I was a little unclear on how we would really be using that. To, I think, hearing Kathleen's point, and as a reminder, you know, when President Trump was elected, we did a whole series of hearings on what we thought the needs were in the community because people were so frankly concerned about what may be changing at a federal level that we brought a lot of people together to say, you know, to give us their feedback. What I'm concerned about for you all, honestly, is that the problem is so big and you're tackling like one component or another and not necessarily having a robust way of sort of putting our arms around it in a way. I think the point that you raised about both definitions and then, which is a really basic one. I think you hear us on the dais, people using equity and equality and interchangeably and not always meaning the same thing. And so what I wanted to ask is, would it make sense for us to structure kind of a workshop of the committee similar to the way we did the hearings after President Trump was elected, in that it was really very community, I mean, it was one way to get a ton of community input into helping structure this in a way that made it easier for you to tackle problem A, problem B, and problem C, and also as a way to share that information with the board, because I think all of us have such different perspectives on it right now that the level setting, I actually was thinking about that when we had the hearing, because both Sylvia and I were kind of jumping in on this, but the levels, even the level setting throughout the organization is pretty challenging. So anyway, I wanted to put that out as an idea, not because I wanted you to have to go write 42 reports, but that really as a way of getting the community to come forward and say what Kathleen essentially just said, which is, here's my idea, here's how my organization thinks about equity, and here's what we're doing about it. And frankly, we've got a lot of people who are doing a lot of work and who've been doing it now for a few years that I kind of feel like, why wouldn't we, borrow from others? I don't know if anybody on the dais, Greta, you want to weigh in?
I was just going to also connect it to, and I think this is partly baked into what you were just saying right now, Supervisors. Also, there was some of the conversations that were coming up during the board priority setting discussion about areas where we're really trying to put a lot of focus of the work of the county, and also certainly in every single one of those areas, a core objective is advancing equity in whatever is the particular arena that we're talking about. And so I think both taking whatever feedback you and Supervisor Arenas want to provide in this setting, we can all also talk about how to potentially integrate some of the work that was initiated through the referral that gave rise to this report with those other conversations that we're having around strategy and the request from the board to think about how we'll measure our efficacy in those areas too, because I think consistent with the board's feedback, part of what we will be bringing back is one that in every one of those areas, equity is going to be one of our core focuses, and how we think about our self-assessment and the community's assessment of us in achieving that, I think is really integrated in the conversation we're having right here.
Well, and I also think, just to go back to the budget process, what was interesting to me is that if we had asked every department as part of the budget book, not just the, that line item, but what their focus on equity is going to be, my expectation is that some departments would have that much more refined than others, in part because of just the work that they've already been doing. And then to be blunt, I'm not sure that just the acknowledgement of it really helps us understand how you move the dial on it. And so in some respects, my hope would be that if we did some sort of more of a workshop, that it would really benefit, frankly, all of you and the staff to really hear like all the different perspectives, because in the end, like someone called me and asked me this question, I thought it was a really important one, which is, how much money does the county spend per household they had it in a particular zip code? And I said, well, great question. We have no idea. And then the other question is, why do we spend so much money on healthcare versus why aren't we spending money on other things? And that goes into both the priorities of the board in the future, but also who are we serving that would not be served, right? Like you think about why we bought St. Louis and O'Connor. We, in many respects, did not have a choice, because had we not bought them, the infrastructure of BMC would not have been able to support and sustain all the people in our community who need our help, and they're in large part lower income people of color. So because frankly, I feel like I could have these conversations at every meeting and not be really helpful to you all, frankly, because it's just one more set of instructions you're going to get to go work on something that's too big for any small group of people to do. So I would like you all to give some thought to that, because I think it might be more productive. Yeah. No,
Well, and I'd be interested to hear your feedback on, there's obviously the trying to figure out also what's the most effective way to have the conversation. Do we have it at the committee level first and then bring it up to the board? Partly why I was raising the question about the prioritization conversations is that work will come back to the full board, and I want to make sure if you think that there's a nexus between some of what we're talking about here and defining these metrics and that we can sync up timing-wise some of the conversations that would be happening at the committee level with the full board level, so that
Yeah, I think the problem here is that I think a lot of the project work that Dr. Luna and her team are looking at have years-long timelines, and we're going to be coming to the board really quickly. And so part of the reason I'm making this recommendation is that I also feel like one of my fears is that we're going to say, okay, your department's in charge of equity, go long. And the budget process also has an equity component to it, but it's not fundamentally changing the culture of the organization if we do it that way. And so part of me is really saying that why don't we just have an out loud conversation? Now, we could have it, I think, at the board level, but the reason I think it makes sense to have it at a committee level is that at some point you need some subset of the board to understand it enough to support the efforts, longer term. And, Sylvia's, and we're kind of a good match in that Sylvia's a newer board member and I'm not so new anymore, and I'll be leaving. And so I think making sure that that transition happens. And then I think absolutely anything this important has got to go to the full board. I just think that the amount of energy and time it takes, we just have to be respectful that we can't do all of that at a board level.
that makes sense. Thank you.
Sylvia?
Thank you. I'm so glad you asked that question because it is an extended conversation of our priority setting from last week. And in trying to learn, as you said, as a new member, what this huge complex system is doing around equity, it in and of itself is a huge task, right? Every department, every division, every service, every program has been functioning, like you said, organically around equity for the most part. But how do we formalize those values and ensure that what we've been doing is around equity, right? It's almost like a check box that we're filling out, and then just ensuring when we say equity, we all mean this, right? We don't mean equality. We really mean equity, and I think that conversation, from what I suspect, and maybe I'm wrong in this, but from hearing your comments now to supervisors or chair, excuse me, is that we haven't had these conversations among our colleagues. And I mean, I think it was, for me, evident from my exchange or my conversations on the dais, and my suggestion was not only to add equity as another value that the board has and something that we want to work towards, right? And that we didn't have it specifically listed, but that we also have a series of workshops or a series of study sessions that we can all have get to a common understanding about what equity really means. And either if it's defined from GARE, right, in their standard definition, or we take a look at that, start off from there, and then add to it from maybe some community input over time or stakeholders over time, because it's not easy. And this is not the easy part. I'm sure that this is a slow process and one that we need to be careful. But how do we, in the meantime, center around equity and ensure that we're all doing it similarly? And I don't have the answer to that, but I know that there's tools that you already have, like impact statements that I was referring to last week. I know one of the impact statements, and I caught in one of the reports, I won't say which, but it said it didn't have the population that, there was a population that was referred to as not having no impact on that population, and it couldn't be further from the truth. And so, have we gotten to a point where we are just saying it's just a standard response and not being careful about how we are using the tools that you've already established as a board to ensure that certain populations are being taken into account. And whose responsibility is that, right? Is it the administrators that we have before us? Is it, you know, the directors? Is it who's ultimately responsible for it? And I say for us, it's the supervisors, that we have to catch that, and we have to make sure that we have the type of leadership that we're speaking the same language, right? If we expect the rest of our county staff to do that we also need to make sure that we understand the differences and those nuances, and that we grow, because there's a lot of personal growth, right? Just because I'm a woman of color doesn't mean that I don't have prejudices, right? That I don't have stereotypes, and we need to have these kinds of conversations with each other so that we can better serve and also keep ourselves accountable, and then keep the programs and services that are before us accountable to what we said was important to us. So I think that there's already a lot of tools in place. I think we just need to bring them back and apply some of those GARE principles once again to those tools. I think we, like you said, I'm not sure what your recommendation was. I heard you say you had a recommendation, but I didn't hear what it was.
And I'll just say what I was going to recommend is that we use the framework that we used in 2016 to have really a community conversation about this. And just as a reminder to all of you, that part of what came out of that 2016 work was the expansion of a number of offices that went your way, the expansion of the work we're doing on human trafficking, the expansion of the work we're doing on domestic violence. All of that came out of that community conversation. And so I think what I would like to do is look at that framework again. I would work with the staff on that. And then, because again, what I don't want you to do is come up with a whole nother report. I think what we really want to hear from is get a community level setting and better understand their thinking, where they are, and that would help us, I think, shape up a work plan for the county that gets us from where we are today. And I think the point that Sylvia raised, I just want to lift this one point up. When we look at our mission statement, it actually did have embedded in it an issue of one of the items did say, you know, serving the neediest in our community, but the language in it was something that we wouldn't recognize today as challenging us to focus on equity. And I think, and so when I read it, I thought, wow, Sylvia was right that it wasn't explicit. And we're in a different place now. We want to be more explicit. We want to be more driven. But what I'm really suggesting is that we look at that workshop model. We did it through Children's Family Seniors. We invited people to come and present. We shared a framework of some key questions we wanted answered. And frankly, even the questions came from the community. They weren't stuff that we drove. It was women's groups saying, we're concerned about the following 6 things. It was the LGBT community saying the same thing, and only their concerns were different. And we had them all come forward. And then what we did is we took the amalgam of all of that. We dove into each of the areas that people were asking us about, worked with the staff, and then prepared something that we used as a work plan for about 5 years. I mean, I think we're almost, I think most of it's been wrapped up by now and on to the next. But I would just give the staff the flexibility to do the kind of listening while they're frankly finding the consultant that they're going to want to get. I mean, that's the other problem, is you need another set of hands and eyes on this, and I know that's a big issue. But what I'm worried about is the work stalling, you guys getting more assignments without answering some key questions so that we can move forward. Because I was prepared to do that to you today, and I thought, wait a minute, I've done this already 17 times. This isn't going to be helpful for them. And frankly, as part of the board's priority setting, I think that's what Susan and all of us are trying to stop doing, is like not make the tree bigger before we know what the tree is, and that's like what we're trying to grow, and that's really what I want to answer. That is the key question I want to get answered. So I would work with staff on creating a workshop here that allowed us to have that community conversation as a beginning spot, and use that beginning to frame up a work plan that was more supportive of something that the board could buy into, so we were all, this is what we're doing on budgeting, this is what we're doing on on goal setting. Here are the departments we're going to start with. Because even when it got presented to us, we don't know what the top 5 or 6 departments are that the administration wants to focus on. I think that would be helpful for us to know. So that's the recommendation we do.
Well, I'd like to add to that recommendation. I'll move your recommendation. Supervisor, I do think that there's the question of these quantitative measures to demonstrate equity impact and the National Equity Atlas and the 32 indicators that they've already identified. I'd love for us to take a look at what the tools are from GARE to help us have these guardrails, if you will, about what has been the process for other communities that have been doing this for a really long time. In Washington State, I think it's Kern County, something with a K.
Seattle King County.
What is it? Oh,
King County.
Like Kern
Yes,
County, really?
Kern County, King County. It was King. And they have this whole, they have this whole plan. And I know it was over years that they integrated the input from community and from stakeholders. I mean, it's just a thorough plan. And during the pandemic, I intentionally signed up for their newsletter and for their updates. And, they were just doing things in a way that I thought, I wish that we were doing that in our city of San Jose. They were, I'm sure they're a lot smaller than we are. I know that they're a lot smaller than we are. They're slightly different in terms of population, demographically, but nonetheless, I think that we can learn from other jurisdictions in terms of process and what has been effective there. One of the indicators that I wanted to highlight is connectedness, and really because we just gone through this pandemic, and in response to the isolation that we've all felt for the last number of years from each other, and more importantly, our youth and our children have felt that in a way that we really couldn't protect them. We might have created some resiliency within our own families and units, and maybe from interaction that we had with our children beforehand to have them be resilient through this process. But I know, depending on the developmental phase of that child, their interactions with the outside world was really impacted. And I know we're seeing a lot of that in our teenagers and our young adults. And so for me, I would really love to see that elevated in a way that, if it makes sense with our community. But the other piece of that, so one, I'd like for us to use best practices from other jurisdictions to help guide us, right? And then second is to have some of these study sessions or workshops between and I know this might be a question back to the Board of Supervisors in the priority setting, but as we build out how we are going to use equity, I think we need to start from the beginning, and that is defining the conversation and having a sometimes awkward conversation with each other about what we think equity is, because it'll lay the foundation in terms of how we engage with one another and how we engage on our priorities on the board, and sometimes the misinformation about what equity really is. And unfortunately, there could be a sense of loss from your, from resources in your district, or what is perceived as a loss in resources in someone's particular district. And I speak from experience because in my district there was a significant number of folks who were just right on, just okay. They were dealing with the pandemic during that time, or when we were dealing with equity and trying to integrate equity, and I knew that there were other districts, like District 7 and District 5, the east side and the Seven Trees south side, that were more impacted, and I knew that more resources just needed to go that way. And that wasn't a loss to my district, but a gain to our city. And so I think there's also like a paradigm shift or a way of embracing equity that is that has to happen in order for us to lead in the way that we expect to see when these reports come back in, right? It has to be integrated wholesomely. So anyways, did you catch that as motion?
We'll reference the recording. We got you.
I will try not to do that again. No promises, but those are the three elements.
It's okay. We'll capture it. Yeah.
Okay, thank you.
Great. So could we take a vote? And anybody else want to weigh in? No? No? Okay. Go ahead. We'll
Could
take
I
a vote
just
on
add one comment before we take a vote? I just wanted to appreciate the conversation because of the challenge in front of us, but I also want to remind the board, the supervisors, that the commitment from the board has been long-standing, and we have a plethora of data that I think is a great jump-off point. What we didn't do was do that crosswalk of all the different assessments that we've done and assessments that are planned or are in the works to really deep dive into each of the subpopulations that we care deeply about and that have very specific and unique needs that are different. But the roll-up of the indicator is really predicated on that framing, that consistent definition that we can all sort of rally behind and that is consistent across all populations. I think that's both the challenge and the beauty of the work ahead. And I just wanted to acknowledge the commitment that you've had before in the data. And it is a core principle of the GARE framework that we lead with data. And I would just to sort of reflect on what we currently know as we go forward to identify those indicators that are most relevant to our local situation here for our people and our communities. So thank you for your ongoing commitment.
Thank you for that. All right. So we have a motion, and the motion is we're going to work with staff to come up with a workshop that allows us to present where we are to the community, get their feedback on it, and then I think what two things that I want to make sure I add that Supervisor Arenas added is, one is making sure that we have a board discussion about what equity is, and I think we would place that after we have the community discussion. Second is that we're partnering with organizations that are already ahead of us, like Seattle King County. And third, I think the point you raised is that we do want to make sure we're using best practices, which I do. I think that's something that the staff really agrees with. And that is our motion, so you only have to listen to that part.
Thank you.
No problem. All right. So we have a motion and a second. You can vote us.
Vice Chairperson Arenas?
Yes.
And Chairperson Chavez?
Yes.
Thank you.
Excellent. Thank you. Thank you for the work. We're going to get in that. All right. Item 9. Item 9 is our substance abuse commercially exploited children, and I'm going to welcome Sharon and Patrick. And I just for background, Supervisor Arenas, this is on our agenda because the Human Trafficking Commission in 2021 asked the county to look into this after the district attorney's office alerted us to emerging trends relative to substance abuse and commercially exploited children. I brought forward a referral to the board in January of last year and put an additional motion in April asking the Office of the District Attorney and the South Bay Coalition to do additional research so that they could come back to us with some items that were actionable that the board could take a look at. And so I'm going to turn it over to the two of you, and thank you for your good work, and it's good to see you both.
Good afternoon. My name is Patrick Van Eer. I'm the lead prosecutor with the District Attorney's Office Human Exploitation Unit, and I'm assigned to the County Human Trafficking Task Force. And off to my right is with the South Bay Coalition to End Human Trafficking, Director Sharon Denoa. This presentation is entitled Enhancing Responses to Substance Use and Commercially Sexually Exploited Children in Santa Clara County. with research and recommendations by the District Attorney's Office and the South Bay Coalition. As supervisors provided some background, this work actually began in November of 2021 when the task force did a presentation to the Human Trafficking Commission on anti-human trafficking initiatives conducted by the District Attorney's Office, management of the Santa Clara County Human Trafficking Task Force. And it was during that presentation we discussed emerging trends, and one of the noteworthy trends involves substance use among our survivors as a vulnerability characteristic, a recruitment tool, and a post-trafficking affliction needing intensive treatment services for recovery. After this presentation, the Human Trafficking Commission requested a report back to the Board of Supervisors on CSEC and substance use, and focusing on additional research that both the Coalition as well as the District Attorney's Office could provide on these emerging trends. And it was last year in April, on the 19th, and the District Attorney's Office presented a report related to various efforts to combat these emerging trends, multiple emerging trends that were discussed, but specifically focusing on substance use among CSEC. And the accompanying the report from the District Attorney's Office was the white paper produced by the South Bay Coalition to End Human Trafficking, which was entitled Understanding Substance Use and Commercially Sexually Exploited Children in Santa Clara County. Following that, this committee placed the item on the work plan for the DA's office and the South Bay Coalition to do additional in-depth research and report, and this legislative file provides that report along with specific elements of a strategic plan to be undertaken by the District Attorney's Office, Behavioral Health Services Department, and the South Bay Coalition, along with other stakeholders that intersect the issue of human trafficking and substance use in this county. Some of the key findings here today show that CSEC and the intersection with substance abuse is a complex issue. Key findings include, here in Santa Clara County, there are a variety of substances being used by CSEC, and the identification of its uses vary depending upon the agency providing the services to the child. Research supports substance use can play a role before, during, and after the child has been exploited. This is confirmed both by service providers as well as other county agencies. The co-occurrence of substance use in CSEC poses challenges for accessing services, and particularly housing and accompanying treatment and support. There are few avenues for data collection and tracking trends for this population and the extent of substance abuse impacting this community. In situations where CSEC are using substances, few CSEC are accessing programming or support for substance abuse. And potential reasons for this include the youth isn't ready to address the issue. Substance use may be a means of self-medicating or dealing with the trauma. And if youth case manager is using a harm reduction approach, use of some substances may not be viewed as a high priority. It's important to note who we're talking about as it relates to CSEC, and it's more than just those youths who are known to being exploited. This report and recommendation also relates to those youth who are at risk but have not necessarily been confirmed as CSEC, as well as transitional age youth who fit the same vulnerability profile as those that have been confirmed CSEC. Now our goals, these goals stem from three key recommendation areas, and they involve identification, data, and referrals. The goals include increasing identification with regard to substance use, frequency of use, and the types of substances used by CSEC youth. Collecting more information and data as it relates to substance use and explore the means of sharing that information related to the impact and the treatment of substance use. Also, increasing the number of youth referrals to substance use was identified. Providing more training to providers to increase the knowledge on specific substances, including indicators of use, impact and harms associated, effective treatment methods, and resources. Increase community awareness about harms associated with substance use to effectuate prevention. And I would add the discussion earlier about fentanyl would fall into this category. and continued research and learning about the relationship between CSEC and substance use.
And as mentioned, there are 3 core recommendation areas: increasing our capacity to identify CSEC and substance use and intersections, collecting data and analyzing data that focuses on CSEC and substance use, and then increasing referrals and thereby increasing access to treatment and awareness of the impact of substance use. In order to accomplish these goals, what we realize is that we really need a comprehensive framework because CSEC and substance use relate to a number of underlying vulnerabilities. We don't have to create the framework ourselves. SAMHSA has developed a comprehensive framework for communities to address substance use. Our Behavioral Health Services Department has adopted that, in particular through the SUPS, the prevention services. So you can see the 4 steps here, looking at diverse community coalitions, conducting a needs assessment, enhancing our capacity, and then long-term sustainability. If we look at the first recommendation area of identifications, there are 2 major gaps in identifications. First, we have youth who may be identified for vulnerabilities related to substance use, but commercial sexual exploitation is not being identified, or their risk for exploitation is not being identified. And that's what these 2 strategic plans relate to. Second, we have youth who are identified as CSEC or at risk of CSEC. They're receiving services in that context, but their substance use or the extent of it is not being identified and they're not being referred to services. Those action steps will be discussed with regards to referrals. The first strategic action plan step here is with regards to partnership with substance use treatment services and the coalition, and this is to ensure that we are training clinician staff on CSEC, exploitation, and the use of screening tools as necessary. We know that there are some treatment staff who may be trained on CSEC, but that's not overarching, and there are a number of clinicians who are not trained on identification of CSEC, but they are likely intersecting with commercially sexually exploited youth or those at high risk. The second strategic action plan step relates to purposeful engagement and partnership with substance use prevention services. And here again, we would be identifying staff within SUPS who would benefit from training on CSEC, but also looking at various prevention programs that should include components on CSEC and exploitation. The coalition would also increase representation at work groups to ensure that we're discussing the intersections of trafficking and substance use. With regards to data, we know that while behavioral health has a 2017 assessment on youth, it would benefit a number of agencies in our county to have an assessment specifically focused on vulnerable youth. A work group that would start to look at this process would identify risk and protective factors that would be beneficial to study in a county-wide assessment specifically focused on vulnerable youth. As to the third recommendation area, we have 6 strategic action plan steps that would help increase referrals and access to services. First, to assess whether we're actually have existing substance use treatment options that are effective or suitable specifically for CSEC and youth vulnerable to exploitation. The second, in order to increase our capacity to identify substance use, we need to develop a partnership between the coalition, prevention services, treatment services, and behavioral health to organize specific substance use trainings for agencies who are currently working with CSEC. Third, in order to increase awareness among youth, we need to have awareness materials that can be created in partnership with prevention services that recognizes the intersection of exploitation and substance use. There are already existing resources from SUPS that just merely need to be adapted and enhanced to specifically focus on CSEC. Fourth, in order to increase our disclosures by youth with regards to substance use and increase their accessing of services, we should adopt a harm reduction approach across all agencies. We know a number of our agencies already prioritize a harm reduction approach, including service providers and health agencies, but a feasibility study may be done to explore the extent to which harm reduction policies can be adopted across law enforcement and government agencies. Fifth, in order to increase referrals to services, a partnership between advocacy service providers and substance use treatment services can help identify referral gaps and develop strategies to increase referrals. Lastly, is to explore community engagement, and this could be through a feasibility study of family centers or community centers, which would aim to increase referrals in our most vulnerable communities. This would be similar to family justice centers, but it would actually be more comprehensive and focus on health and wellness related services. So we asked the board to consider the core recommendation, or the committee to consider these core recommendations and associated strategic action steps, so we can truly help vulnerable youth in our county. Thank you.
Thank you both for the work. I have no public comment on this item. I'm going to see if there are any questions from any of our folks on the dais. Sylvia? And then if there are anybody else.
Oh, thank you, Chair. So I'm going to start with what I was asking in a previous item, and that is the identification of fentanyl and opioid in CSEC, children and youth. I know that's part of what you're proposing to do, but I don't know if you already somehow capture and have a sense of what that issue may look like now.
I can go first. So in a previous report that we did last year for the board, there was data included in that report from the district attorney's office that focused on a pattern of vulnerability characteristics of those who have overdosed on fentanyl,
Oh, okay.
and vulnerability characteristics that are unique to those who have been identified CSEC. And while there is anecdotally fentanyl use among survivors of CSEC, or CSEC survivors, that particular issue has not been studied. But I can tell you that in looking at the data that is currently available as it relates to the fentanyl use within the county, there is a clear pattern of vulnerability characteristics of those that have been identified as users and those who have overdosed with fentanyl to those who are vulnerable to CSEC.
Thank you. I did see that I saw that somewhere in the report that was how this all originated, right? And then, of course, Supervisor Chavez's work to address that. I just wasn't sure what that looked like, if it was specifically fentanyl and opiate, or if it's just like,
Yeah, I mean,
hate to say just drugs.
So I can share with you that in terms of, because I'm a line prosecutor, so I prosecute trafficking cases that come from our task force, and I work with survivors, and I can tell you anecdotally that we see that investigators see it, as prosecutors we see it, and it is one of the reasons why we raise this emerging trend, not just on the issue of fentanyl, but just across the board, substance use among survivors as a vulnerability characteristic, as a grooming tool that's used by traffickers, as a coping mechanism that survivors are using to deal with the trauma associated with trafficking.
Right.
And so it is one of the reasons we raise this trend. But in terms of just looking at sort of the nuanced issues associated with it, anecdotally, I have seen fentanyl use among survivors, and it is a problem, and it is, and while it is not being like specifically studied, it is present, and I think that there's a clear correlation between the data that we do have on fentanyl use and the vulnerability characteristics of survivors.
Thank you, Patrick, for that information, and God bless you for the work that you do as a line attorney and prosecuting attorney. It's good work.
Thank you.
Good work. So, so I'm trying to get my thoughts together because I know that you've all identified. You have 3 key recommendations. And I think part of that is the collection and analysis of the data, but you already have some of the data. Whether it's, your observations, but initially from this referral, there was already confirmation from that. There was already concern about substance abuse. And so, and then, of course, the last recommendation being the referrals in the 6 areas of recommendations under those referrals. And so I'd like to ask from administration, how do we integrate what we're seeing here with this, with the white paper that was done, with this report that's being given to us, and the recommendations that are coming from the district attorney's office and then the South Bay Coalition to end human trafficking. How do we bring those together? How do we overlay so we can actually have some funding to do some of the things that they're telling us that they need to have done?
I mean, I think first and foremost, I would say that some of the really wonderful and rich interdisciplinary work between county departments, including the district attorney's office, the behavioral health department, the Department of Family and Children's Services that has come out of the Human Trafficking Commission and the work that we've done has helped initiate some of the conversations that then yield information coming from the report that we heard today, really driving some of what then comes forward as requests for programmatic change and augmentation or better interdepartmental collaboration that then ultimately gets funded through the budget process or becomes a source of shared advocacy amongst both county partners and others to really increase funding streams available for the type of work that needs to be done in those areas. So I'd say that's the high level answer to your question, but we can definitely think specifically and more concretely about how some of what we've just heard today can translate into some of those types of opportunities.
Wonderful. Well, I will move the item to receive the report and to ask for that level of follow-up, Greta. The other piece is, which I thought was just fabulous, and that is the potential of increasing community centers or like community centers as family, like all-inclusive. Under one umbrella, we've seen how effective that has been for the CAC. And so I just love that idea. I think that it just really facilitates all services for families in a way that it hasn't. We see the schools as that hub. Our families see the schools as those hubs, but unfortunately, our schools just don't have the level of capacity to provide all these peripheral services that are just so important to continue to keep learning on track. But it's not within their purview to provide. And so one of the things that I was hoping that you would do in the meantime while you explore the potential of increasing community engagement through family centers is to explore what is already currently available, and you're very familiar with family resource centers through First Five. I know those are age limited, but we certainly, I think there could be a marriage of funding sources, if you will, between the schools and what they're doing with their wellness centers and what First Five is doing for children under the age of 6, or using some of the city of San Jose alone has 52 community centers, and the majority of those are under reuse. And so that means that there's an agency that is operating, and some of them are not even operating because there's some agencies who've just not been able to carry on their work. I think there's so much opportunity already, and maybe looking at what already exists while you take a look at a more comprehensive family center approach. I had submitted, I don't know if it was this last year or the year before, during the pandemic, I just can't tell. Timelines are screwed. It's like dog years for me during the pandemic. But I had submitted this budget request, and that was to provide a parenting workshops at our community centers, something that's not traditionally done. But I know that a lot of parents were having issues that we normally wouldn't have because we have 1, 2, 3, 4 children in our homes, providing support while they go through school at home, and also having a full-time job. And so it's so important for us to continue to provide support for families. It wasn't approved, but I've always thought that we were really underutilizing some of these hubs that families already engage in. We don't have to recreate, if you will, the wheel. People are already gravitating towards those centers, and those centers have done their job in reaching out and putting the voice out that they're there for our community. So anyways, I'd love for us to continue to explore, and I'm hoping that we can partner with some of those community-based family centers to take a look at what we can do now as short-term. I said I was not going to do that again, and I did it.
Well, actually, so I'm gonna second it with a slight change. And so, are you?
Sure, go ahead.
So I want to see any other thoughts over here, because I know. Okay, so here's so first of all, thank you. I thought this was very, very helpful. I think it's exactly where we need to be going in terms of next steps. I do want to reinforce one of the a number of points that Supervisor Arenas raised, and one of them really is around the idea of the integration of other departments. And so I know we have a whole bunch of partners up here that you're already working with at some level, especially as it relates to CSEC youth, and whether that's probation or the social services agency. So what I would like to recommend is that we both receive the report and move it to the Board of Supervisors in the April-May timeframe, because I want the board to be able to hear this prior to budget, because there are some very real budgetary needs relative to the expansion of the Light Task Force itself, and then the expansion of the investment both in the South Bay Coalition and the Light Task Force. Like, the board has done this in 3-year increments, and I want to make sure we're in or we're out, and I think the only way to do that is actually to let the board have that discussion. So if I could both receive the report and then move it to the board, there are 2 requests that I would like to make prior to this coming to the board. And one is that in response to Supervisor Arenas' point, that we really are looking to lift up the partners that are already partners in the work, and opportunities for their work to be expanded through the recommendations that you're making. And then second, on the issue of the long-term vision around family centers, I would recommend, in response to what the point that that Sylvia raised, is that we restructure that to be an analysis of the current available resources that really will allow us to expand services for services for this population and others, again, that are integrated in. So if that could be a friendly amendment to your motion?
And that's not necessarily an amendment, because it was already, and I just didn't say this because I said it in a very long way, but that was already part of the proposed feasibility study of looking at family centers. So yes.
Okay,
yes.
and I mostly meant the whole of it, because it would go to the board prior to budget.
Yes, and I don't see any cross-references to, so you're going to have to help me with that.
I know, we don't do that here.
Yeah.
And it's really unhelpful. Like, it's something I've actually I'll talk to Greta about it too. It's not that practice that you have at the city is much better than that practice here.
Okay.
So we have a motion and a second, so I'll be seconding Sylvia's motion with that addition. What I want to just add, which is not part of the motion, but just to add these comments relative to it, is this. I do think that the ongoing funding and commitment from the board is really the issue that we're trying to hone in on here. And so when the report comes to the board, it may be necessary to spend a little more time explaining what the Light Task Force is and what it's become and what the needed resources are. And the same with the South Bay Coalition, because I think, Sharon, as it relates to Santa Clara County, there's amazing work that's been done regionally, but as it relates to Santa Clara County, one of the key roles that the coalition has played is knitting together these, in a much deeper way, the nonprofit partners with our public safety partners, and frankly, doing a very good job of focusing our approach on who we deal with as a victim relative to the way we're approaching both the crime and the services component. And I think it needs to be very, very crisp. And then as it relates to this research component, we have family resource centers, we have community centers, we have the family justice centers. And so, and we have 28 clinics that half of them that are owned by the county, half of them that are owned by nonprofits that do all kinds of medical work in the community. We have the Child Advocacy Center. I mean, we have a lot of resources. And so the opportunity to assess that is actually really critical. And I would put that as a secondary based on the first thing we're trying to accomplish, which is making sure we have the appropriate level of staffing that can do that work, and then the other part of it. Because I do think that what Sylvia's raising about being able to leverage resources is really going to be the name of the game, because we know we're going to go into a tighter budget over the next couple of years. Okay, so I'm really excited about that, and I would just say for our partners that are up here, if you see a role, make sure you're feeding into this document before it comes to the board. And I want to make sure, like I said, we hear it before budget. Okay, so we have a motion and a second?
Vice Chairperson Arenas?
Yes.
Chairperson Chavez?
Yes. Thank you. And we're going to move on. Thank you all. We're going to move on to item 11. This is the timely medical and dental exams.
Hi, good afternoon. Daniel Little, Director of Department of Family and Children's Services. So I'm going to go through this presentation and then obviously answer any questions. The current data shows that we continue to see improvement in the number of children with successful and timely medical and dental. As you can see, the percentage for 0 to 17, so that would be our traditional foster youth, has continued to improve to 93% during this last time for medical and 81% for dental. To add some context to this data as well, this is rolling data, so each time I come in and talk about percentages, the children and the families that are contained in the report are going to be slightly different. So as children and families are successful, they fall off the data. As we have new families coming in, they're going to get added into the data. That also means we have less children entering than we have exiting. So the total number of children we're serving is decreasing. So in order to see this percent improvement each time, each child is weighted a little bit more. So we really have to show more significant improvement to continue to see this percentage increasing. Our work with Healthier Kids is also shown to be very successful in doing the timely scheduling and scheduling reminders. So the large percentage of the families served through Healthier Kids, which are children that reside in Santa Clara County, are closed successfully due to the completion of the medical and dental. DFCS also has a full-time staff that's working on coordinating medical and dental for children who are over the age of 17 or are residing outside of Santa Clara County. And then also happy that our public health nurse that partner with us through the Healthy Care Program for Children in Foster Care are fully returned to their assignments and are coordinating care for the children and youth that we serve. We also did complete a survey with the local Oral Health Collaborative Foster Youth Work Group. And you can see the response, we had a 34% response rate. The largest area of barriers was scheduling. So that is something that we're continuing to look at. But going back to the prior slide, we still see even with this report rate of scheduling, we're still seeing over 93% that are actually able to get those timely medical appointments. So also happy to discuss the partnership we have with Valley Medical and with specifically the Spark Clinic and looking at post-move to Spark to the new O'Connor site. Opportunity to expand those hours. We've had discussion about how we can expand those hours to accommodate more after hours. So that is something that's being discussed and is in the planning process. And I think with that, I'll pause and see if there's any questions.
Thank you. We do have a public comment, so let me go to the public comment, and then I'll come to the board for comments and questions.
Hi, it's Kathleen King, Healthier Kids Foundation. I'll keep this one really short, but it has been such a good partnership. If the county ever wants to sit down and talk about how do partnerships work really well, I would say it's with Dan Little's group. So we had a time where there wasn't enough phone support, and we ran down to the office, and there still wasn't enough phone support. We went to Dan's organization, and within the next day, the problem was solved. But I do think that's the advantage of having those help with care and project management, that you might not know the problem when parents are all trying, but you do know it when there's one group helping them. So really appreciate Dan's team. Thank you.
Thank you, Kathleen. I have no other comments, so I'm going to close the public hearing, and I'm going to see if there are any questions from my colleague on this item. No? Okay. So I think, first of all, I want to just thank your staff for getting back to us. And I just, if you could share with your team, I know this has been a big ongoing challenge. I really want to highlight and acknowledge the leadership it took to get our foster kids in getting their exams, and those numbers from where they were to today were, are really very, very impressive and very important for each of these children. So thank your team for that good work. One question that I have that's more broad is, as we're looking at, the moving forward, I don't know what our plan is to keep implementing the high level of services beyond that. And frankly, we've been looking at the hour shifts in another location for a while, and I'm really wondering what's the going forward plan.
Yes, Supervisor, I can talk a little bit about just the collaboration. I know that Dr. Sturm is here, who probably have more information regarding the Spark. So that's something that we could provide today, or I can provide in an off agenda. I do know, though, again, that the coordination between DFCS and Spark and really our broader medical and dental community is going to continue. To your point, to make sure that we continue to see those growth and those outcomes.
Well, and I'm thinking both about our children who are our custodial responsibility, but as we change to doing more intervention for children who are not necessarily formally in our circle of care, what I'm concerned about is what's the umbrella that gets the high need children into these services, given, again, even the survey showing about barriers and the stories that Kathleen raised. But I see Dr. Sturm with you, so I will turn it over.
Good afternoon. How are you all doing? We are transitioning at Spark, as you all know. First of all, we're transitioning from the pandemic. We also have had some internal challenges with folks having lots of babies, which is pretty wonderful, but has created some staffing challenges. As you know, DFCS has been turning from putting children in protective custody to a system where a lot of times children are put into the care of extended family members, and we have responded accordingly at Spark. I'm proud to say that in the 7 years that I've been involved with Spark, we've gone from a system where most of the children and families that we saw at Spark were children who were in traditional protective custody, being cared for by a foster parent who was not related to them. And that's not the way it looks anymore. A minority of the kids that we see at Spark are in the care of an unrelated foster parent. Many of them are in the care of extended family, including sisters and aunts and grandmothers and cousins and all kinds of folks. And just in general, we have expanded who we see at Spark. We are no longer thinking of ourselves as the clinic that sees foster kids. We are considering ourselves the clinic that sees children who have involvement with DFCS or have had involvement with DFCS in the past. So that includes kids who are currently in foster care, kids who are in a more informal relationship with a member of their extended family, kids who have been reunited with their birth parents, kids who have been adopted. And we also are seeing a significant number of babies who were exposed to drugs in utero and are being followed through the Hope Clinic and then come to us after they're released from the hospital. So it is a much broader criteria of kids that we see, and we're hopeful that by opening our arms to all of these kids, we are creating more of an umbrella of kids who are in foster care. The last thing I wanted to say, Dan touched very briefly at the end about expanded hours. We are very much, I can't even tell you how much we are looking forward to having the Spark Clinic come over to 455 O'Connor, which is the location of the Children's Advocacy Center. And in addition to making that an awful lot easier for those of us who are responsible for caring for these kids, what it will do is create real opportunities for us to be flexible with who is working in what clinic and our hours. So we are looking forward to having both the Spark Clinic and the Children's Advocacy Center open after 5, at least a few days a week, which will meet the needs of parents, children in schools, and also families who are experiencing crisis and want to be seen later in the day.
And Supervisor, if I can add to, in the broader prevention work that we do, the physical health is one of the key components that we're looking at. So if that's an identified need for family when we're looking at prevention, then that's the work of either my staff who are doing the prevention work, or if we're referring to a community-based organization for that prevention work, that's a component of what they're going to be assessing and engaging that family to connect with, is that physical health component.
Well, I think that the other issue is that we know that in order that we have two challenges. We have multiple challenges, but two that are still on our to-do list. One is that we need to make sure that children get seen, not necessarily. I mean, not because we don't schedule appointments for them. We may schedule an appointment and not have a parent show up with the child. So one is that we know that a lot of our clients need more attention to how they get seen. And so that's one issue that I'm very concerned about. And then the other is that I want to just acknowledge the point that that Dr. Strum raised about who we're seeing. We haven't made a formal policy change in the sense that I've seen, at least, or that we've discussed here, or that the board's discussed as a whole, recognizing that our new approach to how we're addressing families in need really is requiring us to do much more services on intervention, on prevention, and then kind of a much deeper dive on intervention. And therefore, the service model that we're using is shifting from one where a child needed to currently be in foster care for us to provide a certain set of services to children that have ever been in foster care, are at risk of foster care, who, whatever that new definition is. And on top of all of that, I know that our system continues to have a strain in terms of having enough, dentists that take children and that have the right hours. And so what I'm really wanting to understand is, if we're making these changes, who is it that can be seen by what organization? And Greta, this kind of goes back into your bucket just for a moment, which is that I think that having that, at least a sketch and a framework, come back to committee so we can all say that's what we're doing and here's how we're doing it. But this is one of those areas where the relationship between our staff in the SSA side and the really deep and meaningful connection to the hospital system, and it's part of the reason I've been focused on this business plan, because we have to build in that long-term sustainability to that healthcare system. And part of that is when we have patients when they're young that have a good experience, they stay with us when they're older. We want their families using as much as possible Valley Medical Center, and making sure that we have children signed up for health insurance and their parents are signed up for health insurance, whatever that insurance product is. And so from my perspective, this move actually has some other kind of moving parts to it. So I'm interested in understanding how are we providing the services that both get the child, the initial exam and then get the child the services they need based on that initial exam. And then from a business perspective, making sure that we have the folks showing up. So what I would like, that is a long way of my way of saying that I want to receive the report with a request that back to committee, that through the county exec's office, that we answer that question about the who, the where, and the how differently, recognizing that we're in a different situation than we were 4 or 5 years ago as it relates to how we're addressing children. Is that clear?
Yeah, I think so. And if we need some kind of further clarification to make sure we're bringing back exactly what you're hoping for, we can definitely also talk with you about that offline. And I'll just kind of zoom out and just make the observation. I think a lot of what's being talked about here in terms of families and specifically children who are having contact with because of the dependency system, and also our efforts around prevention and trying to use, when we have contact with them, the ability to get them much more connected to physical health-oriented services. There's synergy with, I probably some folks have already seen the news about, just hot off the presses yesterday, California being the first state to be granted a waiver that will allow for enrollment of folks who are touching us on the justice system side to come into Medi-Cal. And so I think there's a lot of opportunities for us to leverage the fact that we are one of the very largest healthcare providers for residents in our county, but we also touch families in lots of different ways, and we try to use that as an opportunity to also get them other types of services they need, and specifically ones around their physical wellness.
That's exactly right. And just to make an observation as a reminder that we have families that still have a fear of accessing services, right? And, I think the work that the Healthier Kids Foundation does of really doing the initial exam at school, both for dental and eye glasses and mental health, like all of that, I mean, that's really deep into the community, which is exactly where we want to be, and then to be able to pull them into these services. So that's really the question I want to get answered, which is, I know the system we have now, and I know who we were serving. What's the system we're planning in the future, and who do we anticipate that will serve, is really the key question. And that I would make in the form of a motion. I'm recognizing there's that 45-day thing. I'm not going to give the time, but I'm going to ask, because it may require staff to dive in a little bit. But I do want to have at least a big answer to this question prior to budget, because I just want to understand if there's anything that we need to do now to make that a realization that we're not waiting. All right, so we have a motion and a second.
Vice Chairperson Arenas?
Yes.
Chairperson Chavez?
Yes.
Thank you.
Thank you. All right, we're going to move on to item 12, the VASC.
Good afternoon, supervisors. Keeley, Deputy County Executive, as my colleagues from FAF and Behavioral Health make it up here. We have a short presentation for you today, or we can sort of just skip to questions, your preference.
Why don't you go ahead and do you all wait, just do that many as fast as you can, and then and I apologize, everybody, we're going to try to keep our meetings within 2 hours, and so I apologize for letting this go, but go ahead.
Very good, thank you. Mikhail?
I'm going to have Roberto start with the construction updates.
Great. Roberto Mendoza with Facilities and Fleet with the construction status update. We have the egress stairwell. Progress was partly hampered due to weather, but we're still tracking for October 2023 completion. The public art was just finished up this week, so just in time for the Lunar New Year celebration. We braved the weather and all, so that was amazing. And lastly, we have some dental suite upgrades. These are some dedicated air compressor and vacuum and infrastructure, and that just got permitted today. So we are looking to mobilize the contractor in the next couple of weeks. And that should be about a 3-month construction period. That's all I have.
Great, thank you.
Right. We are at our 1-year anniversary since we launched our healthcare or core services at the VAS. So it's been a year that I've been at the VAS assisting with healthcare services on the second floor. We continue with our effort to collaborate with county agencies, CBOs, and our volunteer providers to develop programs and services to address healthcare disparities and core services. Within the last 2 months, we brought in 2 new providers, which are helping parents and cancer care points. And we have a few additional wellness programs and activities. On a monthly basis, we provide about 110 to 130 recurring programs and activities. In December, we had 132. Next slide. So it's been a year since we launched our healthcare services. And as part of the improvement process, we hosted 2 community convening sessions in Vietnamese, one during the early afternoon, one in the evening, to accommodate everybody's schedule. And we had a total of about 130 attendees. We received a lot of feedback as well as lots of compliments on our services, lots to improve as well. We also hosted a stakeholder meeting with our CBOs and our volunteers to gather feedback and discuss service improvement, collaboration, and future services. And on a weekly basis, staff continue to continue their outreach and engagement effort by reaching out to the local communities. And we continue to trend toward the right direction. This is a summary of our service data. And for future services, we're looking at ramping up staff capacity so that we can increase our productivity and services. And that concludes our presentation. We can answer any questions you may have.
Excellent. I have no comments from the public, so I'm going to close the public hearing. And the only thing I wanted to just say, I'm really excited about the event tomorrow to celebrate Lunar New Year, and want to make sure everybody knows that they're invited. It's going to be 11 to 4 at the VASC. And we're going to be launching the public art tomorrow, too.
Correct.
Which is really exciting. I mean, really, I cannot wait. That's been one of those, anyway. Long story short there. Yay. Any comments or questions?
Yes, so I was wondering, and I looked at the list of the folks that you all work with as stakeholders that come in and provide services, and it looks great. It sounds like you've been doing a lot of work for about a year now to get this up and running, and it's beautiful. As I drive through to get to Costco, I see it each and every time, and I just think how lucky our community is to have such a wonderful place. And what I'm wondering now is, as things surge, such as the shootings that happened just recently, is there any emotional support that we're providing and that we're announcing and networking with our community, our Vietnamese or Asian or API community, to respond to that? A healing, sometimes there's some healing classes and workshops.
Thank you for the question, Supervisor Arenas. And yes, we the management team already discussed some of the support groups for our community. We are waiting for sometimes next week to launch some of these supportive activities or programs because we have the Lunar New Year coming tomorrow. We are looking at launching some of these support groups and discussion sessions for our community members.
Wonderful. I look forward to seeing how that looks like. I know that there's been incidents throughout the years, and some of that just gets layered on, right? And when something like this, even much more, or a mass shooting and tragedy happens, it can just open up some wounds. So congratulations on getting the VAS ready for tomorrow. Happy New Year. I'm not sure, I don't know if I got invited, but if I can make it, I will make every intention. We have also a TEP festival happening in my district, just down the street from you all at Eastridge. But congratulations. Sounds like great work.
Very good. Thank you all. And I don't think we need to take any action on that. So thank you. All right, we're going to move to item 13. And item 13 is to receive a report from the Santa Clara Valley Healthcare and Facilities and Fleets Department. Oh, I'm sorry. Yeah, related to the Youth Advocacy Center. And so I'm going to invite the team up. And so I'll see first, let me go to you all and let you introduce yourselves. And then I want to make sure that one of the reasons I wanted to make sure this came back to us is I'm very interested in the increase in the medical exams for the Child Advocacy Center in particular. So Dave, do we start with you? I didn't mean to put you on the spot. I didn't know who was starting.
Hi, Dave Barry, Chief of Planning, Facilities, and Fleet. Sorry, it's been a long time since I've been up here. Forgot how it worked. I could just report to you on what the status is on the construction, if you'd like to hear about that. So, in particular for Spark, construction is still in process. Dental casework will be installed in April. Furniture is coming in May. Medical equipment is slated for June, and stock, staff, and the simulate estimated 30-day post-certificate of occupancy period is plus or minus in July. So that's where we're at with regard to construction.
Excellent. Anybody else?
Okay, hi, good afternoon. I'm Serena Tsai, and I'm going to give you a quick update on the PDSC. So we opened our doors on January the 4th, and as of today, we have seen 22 patients. As of the end of January, it will be 28 patients. Then in the month of February, we anticipate opening an additional day per week for a total of 3 days per week at the site. And then we are working on still the MOU with the County Office of Education. It's almost done, but we're still working with council on that. So,
what's the estimate on that?
For the MOU, I'm not exactly sure. I think it'll probably be wrapped up in a couple weeks.
Great. If it extends past February, could you let us know?
Okay.
Thank you.
And I'm going to, sorry. I'm going to turn it over now to James Gibbons Shapiro
Hello.
and to Dr. Sturm for the Children's Advocacy Report.
We're so glad to be here. We have answers to your questions, but we also are here to ask for an invitation back. We'd love to be back in March or April to give you a comprehensive report on the first 2 years of operations of the CAC. So if that works with your schedule, we'd love to come back and give you a fuller report. Can I get the slides up? Okay, causing problems. There we go. Okay, so I think this first slide is the one that you had a question about. So there's an increase. The star on there is the opening of the Children's Advocacy Center. So you can see that there was an increase going on already for the increase in the number of initial medical encounters for children related to physical abuse and sexual abuse that was happening, and that has continued to increase. In fact, it's gone up dramatically since the opening of the CAC. But it's part of a larger trend. I want to, oops, there we go, boom. I want to augment that first slide, which was talking about initial encounters, to say that a big difference about what's happening at the CAC since before the CAC is the increase in the number of follow-up medical visits that children who are abused sexually or physically are getting through our services. So that is up 56% from the previous year, and really a dramatic increase of follow-up visits from before the CAC was opened. All right, one of the things that accounts for the overall rise even before the CAC opened is, and this slide, by the way, is from the DA's office's 10-year crime report that was submitted to the Public Safety and Justice Committee at the end of last year, is the overall rise in certain categories of violent crime. And one of the categories of rise is rape, which includes child sexual assault. And in fact, in our county and most places around California, the largest component of the statistic of rape that's reported to the FBI is child sexual assault. So this doesn't actually include all different child sexual abuse, but I think it shows the overall increase in reported sexual abuse, reported child sexual abuse over that time period, which accounts in part for that increase. But I think that one of the other really important parts of that increase has been something that we really hoped was going to happen when we opened the CAC. Supervisor Chavez, you held public hearings that then Councilwoman Arenas was at, now Supervisor Arenas, in the spring of 2019, where we were talking about the need for a CAC. And one of the things we talked about was the suspicion that we had that there was a gap between cases that were reported to the police and connecting those cases for medical services. And what we found since we've opened the CAC and we're under one roof is that we've developed the relationships and the partnerships to close that gap. So first, starting with our main partner, San Jose PD, which accounts for more than 50% of the criminal investigations in the county, and that includes child sexual abuse. We have a procedure for them to have 100% medical handoff. So every child who's interviewed by San Jose PD for a forensic interview at the CAC, 100% of those kids and their families are connected to the medical team for medical services. And that 100% handoff, which started with San Jose PD, is part of the new child abuse protocol that we anticipate is going to be approved by the chiefs of police for every agency in the county in the next 2 months. So that is a huge part of the increase, is closing that gap between what law enforcement is doing and what the medical team was doing. I want to turn it over to Dr. Sturm to talk about a really exciting thing that she's done, but the result of the exciting thing that she's done is going to mean that we're going to, in addition to this countywide protocol having an increase in medical services, we're going to even see a larger growth in medical services for abused and neglected children.
Is it on? Oh, it is on. Okay. First of all, I wanted to just say one thing about the medical handoff, because I think it's really crucial you understand it. Basically, the medical handoff from San Jose involves choice, letting the child and family have autonomy about what kind of health care they want to have. So there's 100% handoff, but that doesn't mean that every child and family gets exactly the same menu of options. We offer them a SAFE exam, a sexual abuse forensic exam. We offer them laboratory testing, and we offer them medical treatment. So, for example, they might need a booster of hepatitis B, or they might need antibiotic treatment for a sexual transmitted infection. And it's really interesting to see what families choose to do. The majority of families choose to have all three. They want to have everything done. They want to make sure that their child is really safe. And the child, if it's a teenager, they may specifically request themselves to have all of those services. But sometimes families just want to have the testing and the medical treatment, and we completely support that decision. And sometimes they want to have those things, and they say, you know, we want to have the exam, but having the interview was very intense psychologically, and we want to come back a different day and have the physical exam. And so we support families doing basically whatever makes sense for that child and whatever they're up for that day. And it's lovely, you know, between 80 and 90% of families will have everything the first day, and another 10% will come back another day and have more testing or have a follow-up exam if they have questions about the findings. And we're very proud that part of what we offer is patient autonomy. We think that's so important. So the thing that James mentioned that I was going to talk about is what we call in-house the One Phone Number Project. And what the One Phone Number Project means is we have established a hotline through the Children's Advocacy Center that any child protection professional, whether it's law enforcement or the DA's office or DFCS, or a provider within, a medical provider within VMC, outside VMC, a provider who has nothing to do with the county, somebody in private practice in Los Gatos, if they want to consult with us about child abuse, we're now available 24/7. It was a huge lift, as you can imagine, for members of our team, but the main clinic line at the Children's Advocacy Center, which is 669-299-8810, is now available 24/7. If you call after 5, it rings a little while. There's a message in English and a message in Spanish. And then after 5 or 7 rings, it comes to a senior member of our team. And the call can be about physical abuse, sexual abuse, neglect, abduction, child torture, and CSEC, trafficking. Any of the forms of child maltreatment that we address at the Children's Advocacy Center, and we help the caller make the next step, first of all, in terms of scheduling exam, helping them understand what happened to the child and what an appropriate next step might be. And we call it the Child Abuse Medical Consultation Hotline. So we modeled the program very much after DFCS One Phone Number for the CAN Center, for the Child Abuse and Neglect Center, and we consider it part of our mandate to remind whoever calls us that a call for medical consultation does not replace the mandated reporter's obligation to contact the child abuse, the CAN Center and or the appropriate law enforcement agency. So I can't even tell you how happy I am to say that it's working. The technology is working. We're getting calls every night from all kinds of, from people that we would expect, like cops and social workers, but we're also getting calls from parents. We're also getting calls from other medical providers who aren't quite sure what the next step is. And senior members of my team are much more qualified to provide those answers after hours rather than the VMC operator, which is the way it's been for a very, very long time. So my thanks to senior administration at VMC for approving the project, and obviously Mary Ritter and my colleagues for participating. Again, it's the senior members of our team. They're not moonlighters, only people who are seasoned members of our child protection medical team are participating. And I'm very hopeful that it's going to really change the medical response to child abuse in our county, and it's going to massively increase our numbers. So we will definitely be needing more staffing.
The police agencies are really delighted with this change because previously it was if the child is under 12, call this number. If the child is over 12, call this number. If it's an abuse case, call this number. If it's a sexual abuse case, call this number. And it was
and it was being triaged by the VMC operator who couldn't possibly get it right a lot of the time, right? So now the right people are taking the calls, and I think it's the most important thing we've done since opening the CAC. So I'm very grateful for the support of our collaborators, we're always supportive of our collaborators, and also the support of senior administration at VMC.
Thank you. Thank you for the report. You know, First of all, this is a really important report, and actually the next one we're going to have is really important, and they're at the end of a really long meeting, so we will definitely have you back. One request that I'm going to make when you do come back is, one, as it relates to the entire center, it's like we've rolled up these 3 reports or 4 reports into one report. And I'm going to ask that we do a mini presentation on the purpose of each entity and where we are in process, because I think, I've been working on these and I still get them confused. So I'd rather, to have that come back as a kind of a full report. And then second, I think it's going to be very important that the Social Services Agency be able to do, concurrent to this report, an update on the CAN Center, both where we were in terms of responsive calls and where we are now, and then how these hotlines and the background staff response is going to be handled, and is handled today, but what are the improvements offered? Because in fact, if we have one number, then the improvement between the communication between the 2 centers and the investigations should be more clear than they have been in the past. So I'm going to want to see that. And so I think we probably should target that for March or April, so that you have time to be able to answer those questions. And then just one thing on the advocacy center, on the center that tests. You guys gave it a different name than I gave it, so I always get it confused. But anyway, on that one, I'm concerned about the footprint still being too small for the work that we're doing, and I want to make sure that we have a conversation about that relative to volume for all of these services. Sylvia, do you have any comments?
Yes, I do have comments. First of all, just congratulations on integrating all of these phone. Sometimes the most difficult thing are the simplest things, and that's technology. Sometimes it's not our friend. And so congratulations to the work that you're doing there, but also just the work that you've done so far. Being on the other side with the city and hearing, that of course, you said about 50% or maybe more than 50% of sexual assaults come from the city of San Jose, and that's fair to say because we are probably half of the county, right? It breaks my heart to hear those kinds of statistics, and it breaks my heart to hear that there's so many calls that are being made. On one side of this, I want folks to call, and I want them to get the people who are concerned to get the right information and begin the right process for the referrals, but knowing that there's this increase, it burdens my heart, and so I'm sure that there's some level of exhaustion on your end and all the stakeholders who are involved.
I feel like I have to respond to that.
Please.
People often ask me how I sleep at night, how I can manage the work that I do. And I have to tell you, speaking for those of us who do this work every day, the assaults on children are happening, right? The abuse of children is happening. Unfortunately, it is part of the human experience, right? It's part of what human beings do. And we have the extraordinary good fortune at the Children's Advocacy Center to take care of those kids and to make things better for them. And it's real. We see they have a good experience at the Children's Advocacy Center. I feel almost funny talking about it in terms of numbers, but we do an exit interview at the Children's Advocacy Center of every family, and more than 90% of the families who leave the Children's Advocacy Center talk about how they've had a good experience, that it was a surprise, they didn't expect to have such a good experience. And so it's really okay. Every kid that walks in and my heart aches for them, I know that I'm making their life better, and that's really where we come from. So it's
Dr.
I don't want to say it's only good, but it's remarkably good.
Well, listen, I am absolutely just grateful that our children have you and have everybody sitting at the well here. And in the audience, so not to leave anybody out, because everybody's done their part. And so, yes, absolutely. And that is the kind of leadership that should be at the helm when we're dealing with children's issues, especially around abuse. And so thank you for interrupting me to make sure, not interrupting, I apologize, I misused that word, but to refocus, really. We've been dealing with this issue for many years together as systems. You a lot longer than obviously than I have, and so I'm not there yet. But I love changing systems in order to serve our children and our families better, and so that's what I tend to focus on. And this is one of those system questions, and one of the things that we found, I don't know if you remember this, Cindy, but we had Dr. Bauer come provide public comment one time at one of our joint meetings, and she talked about how are we all preparing for this flood of child abuse cases that we project seeing through the school system. And how are we going, because there was a gap. She was identifying a gap between the police department and not necessarily San Jose, I'm sure all police departments, but probably San Jose. And I don't know if she stayed involved with the CAC advisory meetings, or there was some subgroup for the CAC, I thought, that she was supposed to join. And so by the look on your face, I'm going to assume that that wasn't the case. And so my question then is, what's that relationship between the CAC Center and school, and directly with the schools, right? Because the superintendents know what's happening in their schools, the principals know what's happening in their schools the best. It's best to have those direct relationships, and we know some of the zip codes that unfortunately are impacted either because there's dense housing, and this is a crime of opportunity, or for whatever reasons, we find ourselves identifying certain parts of our county and our cities that are impacted this way. And so how are we also pulling those folks in? So say for these phone calls, do we have schools calling in? Are they also part of that? I mean, because it sounds like parents can even call in. It doesn't have to be medical providers.
Anyone can call, but if we get a call from someone who isn't law enforcement or DFCS, we're going to say to them, yes, absolutely, we want to help you, we want to see this child, but you need to circle back to the correct path, which
I
is
heard you
calling
say that.
law enforcement or DFCS. So you can actually, if you spend a day at the Children's Advocacy Center, you can actually see the funnel happening over the course of the day. Kids go see their pediatrician in the morning, or they go to school in the morning. The pediatrician or a family practice doc, whoever sees them, identifies that something has happened to them. A teacher at school identifies that something has happened to them. And because they are mandated reporters, they call the CAN Center, or they call law enforcement, but oftentimes they call the CAN Center. And then by the late afternoon, we get the phone call. So it comes to us. So that is the traditional route for how an incident that was reported in a school would come to us. But of course, if we were to get the call directly from someone at school, we would encourage them as a mandated reporter to take the proper path, but we wouldn't punt. We would say, we can see this kid tonight, we can see this kid tomorrow. We absolutely want to help you with the process. This is what the process looks like. And in the meantime, this is a time that we could see you tomorrow.
And thank you. That's what I needed to know, because one of the concerns that Dr. Bauer expressed at that time was that because our police department is so understaffed, this goes to the bottom of the list. It may take hours and hours, or the next day, or a couple of days. And a lot of the times, it just takes a lot of courage for that child to approach that teacher and for that to actually happen. And so then we miss this opportunity to support this kiddo because now the teacher has to move on with whatever it is that they're dealing with in their classroom. And they just hope that this has gone through the right process. And so anyways, I'd love to see a more formal relationship with those schools in some of our districts that we know are just impacted. I would say all school districts, but I know that you are all limited, and I think we can start with some of the schools that are impacted.
We have a plan.
Oh,
You know,
okay, wonderful.
We're at the end of our second year, right? We are still very much
Right.
figuring out all the connectivity and all the ways that we work together, which is so, I mean, it's just so beautiful. It's the collaboration that happens at the Children's Advocacy Center really is as grand as it was built before we started the place. You're going to get an ask from us for an educator, right? And so when we have a full-time educator on staff at the Children's Advocacy Center, a big part of that role is going to create integrity and continuity with the schools. So what I would say about that is that we have come so far in 2 years, we can't even believe how far we've come. You know, we never imagined that we would have this kind of increase in the number of kids and families that we're serving. And we do very well understand that in communities across America that have successful CACs, and we are one, the CAC becomes the locus for education in that community. And so we do envision that over the next 5 years, we will become a center of education about child protection, child abuse prevention, not just the response to child abuse. But we have to get there, and I think in our third year, that is definitely a goal.
Oh, I can't wait, because we did our piece about prevention with healthy relationship workshops at high school level, although I think we should start at really elementary at this point. With a YWCA, but I think I loved that idea to really formalize that prevention piece and pull in the stakeholders in a way that's effective. So anyways, looking forward to that piece. I thank you for letting me know that there's already some work in the pipeline to integrate schools, and especially with, did you call it an outreach coordinator?
Educator.
An educator, excuse me. So
But the educator would be doing outreach.
well, then there you are, one and the same. Okay. Thank you so much, and I'll motion to receive the report.
We have a motion to receive the report with the report out being in the March-April timeframe that we discussed earlier with each, hello?
Yes.
with each area with a little bit more background on it, and then even on this issue relative to the educator, I do want to go back to the social services agency and ask that this be coordinated, because we also have an education partner or a couple of them in the social services area, and so let's make sure we're integrating all of that work. All right, we have a motion and a second.
Vice Chairperson Arenas.
Yes.
And Chairperson Chavez.
Yes, thank you so much. We're now going to item 14. And Sarah, I'm going to turn this to you.
Thank you, Chair Chavez. Can you hear me?
Yes.
Okay. All right, thank you. And thank you, Vice Chair Arenas. Sarah Duffy, Chief Children's Officer, with the status report from the Office of Children and Families Policy. This month I have a briefer report with updates on priority initiatives. So the Department of Children and Families Policy, in partnership with Behavioral Health Services Department and the County Office of Education, is overseeing an operational plan to support strategic county investments in the expansion of school-based behavioral health. And our office is planning to return to CSFC in March with an overview of the plan. So we're very excited about that. With regard to supports for children who have lost a caregiver to COVID-19, through the county's contract with the Bill Wilson Center for Living with Dying, grief counseling support has been provided through 11 referrals at this point, and we have room for up to 25 referrals this year. First Five is now 6 months into some really exciting work associated with 3 initiatives to increase the credentialed early care and education workforce and provide technical supports needed to keep family care providers in the field. So our office and First Five have provided an update on the initial implementation of these initiatives in December to CSFC, and will return at the end of the year with a report on the first year's outcomes. With regard to the contract between Behavioral Health Services and the County Office of Education on supports for school districts in Medi-Cal billing, there's been quite a lot of activity recently in that area with training sessions for school district staff, establishment of a professional learning community with scheduled monthly meetings, and the development of a youth health and wellness billing resource website. And finally, on January 10th, the Board of Supervisors approved amended bylaws for the Youth Task Force related to adjusting administrative functions and key roles with the transitioning of the Youth Task Force staff duties to our office. And on the same date, the Youth Task Force had their first in-person meeting with this new structure. So our office is working with the Youth Task Force members to support their fiscal year 22-23 priorities.
Excellent.
So thank you, and I'm happy to answer any questions you may have.
Thank you for that. Sylvia, did you have any questions?
Yes, just how is that youth task force doing or in terms of participation?
You know, it's so our office just started attending meetings. I think back in October after the referral passed that the youth task force would be transitioning under our office, and we've had really good turnout. And so far they met quorum. We were a little worried last month with the first in-person meeting, knowing that youth are coming from all over the county to the meeting, about whether everyone would be able to make it, and we had a really great turnout. So the youth are very, very engaged. They have a lot of areas that they're very interested in, and so we're really focusing on getting them to hone in on a couple key priority areas that align with the priorities of the supervisors in the county right now. So really excited about that work.
I'm excited too. So how do we align with equity? I'm sure that a lot of our youngsters already are very hip to what equity is and have done their own education, right, about this and really integrated it into their daily lives, bringing it up in classrooms and things of that sort. And so, but how are we responding or supporting them with that learning?
Yeah, so we actually added a section of the bylaws that adds that, you know, the youth, one of the goals of the youth task force is to do the work with a pro-equity lens. So that's some new language in the
Right.
bylaws. And as far as kind of how our office will be supporting that, we definitely want to think really critically about equity as we do the outreach and we do the application process for new members. So that'll become kind of infused in the youth task force processes. And then as they work on their priority projects, we're really fortunate to have our office is adjacent to the Division of Equity and Social Justice, and we'll bring staff from those offices in to help advise and inform and do, learning development on areas of equity. So just to give one example, there's a subcommittee on gender equity, actually. So they really want to focus on that area, and we're excited to be partnering with the Office of LGBTQ+ Affairs and of Women's Policy to bring in very pro-equity knowledge that they're already, really focused on. So I think it'll be a natural kind of direction and fit for the task
Great.
force.
It sounds like some informal workshopping within the process. I'm glad that you're also taking into account equity as you're deciding who is going to be in the youth task force. We've found in our city side that a lot of the youth that's involved is primarily very resourceful and on track to college, and this is just maybe something that they add to their resume, which is okay to do, but it isn't reflective of all of our youth and their experiences, and so I'm glad you're taking that into account. Those are my questions. Thank you.
Great, thank you. Sarah, I know at the next few meetings that we're going to have the wellness study results in March, universal access in April, and then the child care facilities in May. And anyway, I just wanted to make sure we put that on the record because I think those are really important chunks of work that are going to be coming down the pack. So thank you. All right, so we're going to move on to Nick, and we're going to just go up the line. Anybody who's got a update they want to give us, this is a time to do it. I feel like it's like the 13th inning at a game, and you should all get a little pin. So, and again, I apologize. I know we started late, and you know, we'll be mindful of that in the future. But go ahead, Nick. Let me start with you.
So good evening. Nick Bircher, Chief Probation Officer. Just a couple things. The first thing, and Greta mentioned it earlier, about being the first state in the nation to expand Medicaid services for justice-involved folks, both adult and juvenile. So this is new, and there's going to be a lot of information coming out still on that and where we fit in and how that fits in, but pretty exciting news on that. Secondly, just to highlight and bring to everyone's attention, the Mercury News had an article today about the work being done here in Santa Clara County with justice-involved girls and getting to zero through the Vera Project, and how that is now going to be a statewide process as far as putting out grants for other jurisdictions in the state of California because of the work that was done here. And I just want to highlight and bring to everyone's attention the work that was done with the Gender Responsive Task Force over the past few years to get that process really to where it was today. Really happy about that.
Great work.
Thank you.
Congratulations.
Thanks.
Ignacio, may I go to you? We're just going to go down the line.
Thank you very much. I just had two relatively quick updates. One is about our performance. Our December 2022 performance numbers are out, and Santa Clara County DCSS ranks as the highest performing, largest caseload county in California. Wow. We're the highest ranked among Bay Area DCSS offices. We're ranked 13th out of 52 county child support agencies. So they compile our federal performance measures into a factor, and that's how they rank us. So we rank the highest in the Bay Area. The next largest caseload county in terms of caseload size is Alameda, and they're ranked 33rd. So we're significantly better, which is great to report. So, and that's despite all of our funding and staffing issues that we've had, we've managed to overcome. So that's great news, and I want to thank all of our great staff for the work that they do to contribute to that. And then the second thing I wanted to mention is more of an update on staffing. Regina Martin, our longtime deputy director, has announced her retirement. So she's been with us almost 6 years, and she'll be retiring in March. So we've opened a recruitment with County ESA. We have an executive recruitment that closes next Thursday. The following week, we hope to have oral board panels set up. And so we're working on that process. It's a national recruitment, and I'll be reporting back on how that goes. And that's all I have.
Thank you, and congratulate your staff. That's tremendous work.
Thank you.
It really is, and especially given the state's so unhelpful.
Right.
So, well done.
Good evening. So again, Sandhya Hermaun, Interim Chief Deputy at SSA. Three specific things that I wanted to report out on. First, the enactment of the federal budget has started unwinding the public health emergency. And what that means for us is the CalFresh emergency maximum allotments will end, and it means and also the resumption of our Medi-Cal determinations. We started the process for sharing this information with clients and how it affects them. Second, DFCS County Council and our Dependency Advocacy Center were invited to present on our prevention model at an upcoming national conference on child abuse and neglect. And third, and very importantly, today starts the 30-day countdown clock for our CalSAWS implementation. February 27th is the go-live date. Clients will transition from the online self-service portal, My Benefits Calvin, to Benefits Cal. So that's it for me.
Thank you for all of that. Well, let me just say thank you very, very much. We're going to end our meeting, and we're adjourning until February 23rd at 2 o'clock. And I just, again, want to say to all of you, thank you very, very much for all of your work and for being with us so late. And as always, this is a group that has a lot of questions. I do want to just say one last thing. I hope to encourage all of you, as reports come to us, to start to weigh in, because I think the point, I just want to really highlight the point that Sylvia raised about how we do a better job of integrating our work. And part of the reason we want you to be part of the committee is really so that we're saying, hey, I'm working on that, and maybe we should have a conversation. Because sometimes, frankly, the opportunity we have with the jobs that we have is we're reading all of your materials. And so we sometimes see departments that are very separate and wonder exactly what Sylvia said is, wait, sometimes even on the same agenda. So I really want to encourage all of you to give us feedback and to give your colleagues feedback. It's really, when I look over to you, it's really intended to be an invitation to give us your thoughts. And I'll manage the agenda better. All right, thank you, everybody. Have a great night. I appreciate you.